right.
So you can pass all those. Oh, boring.
This is everything Maria
Yeah,
just
this is
said.
everything I said, which normally takes us 2 hours. But I'm from New York, so I do things.
So we know what we're trying to solve with
I don't do
this.
the O's.
You don't do
No.
the O's.
No, I don't have 2.5 dishes.
Come on now.
Pizza. Pizza, coffee.
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 All right, so she went through all of this. Who in here knows whether they're year 1 and 2?
This is important.
One.
Okay, what about 3 and 4? I do the same. I'm 1 and 2 and I'm 3 and 4. So she is as well. So it's really important that you guys, if you haven't collected the data the way that they're looking for it, you may have to go back into your systems if you're 1 and 2. So just something to think about as we go through this.
Oh, yeah, these are good questions.
So you have the option, you chose the option, maybe, if you went online in the very beginning before the pandemic started, you chose whether you have a fiscal or a calendar year. Who in here did that? Who in here did not? Who in here doesn't know? Fair. All right, so they may have chosen for you, and if they chose for you, it is a calendar year. It is not your fiscal year. So you may want to check into that. Is there a way to see how we respond to the selection letter? That's what went out before the pandemic. There was a selection letter that went out to each of the ambulance services, and that's where you had to go in and choose whether it was calendar or fiscal.
And I will say there is an email that they provide and say, yes, email us and we will tell you. I've emailed them and I still don't know. So I'm just assuming it's calendar year.
Yeah. We don't do a lot of Medicare. Couldn't we just take the 10% penalty? I think you did a great job of talking about that, Maria, is yes, you can take the 10% penalty, but it will hurt all of us potentially in the long run. If those big services are the only ones reporting, it's going to hurt us all. I'll let you take this one.
So like Maria said, yes, we can file for exemptions, but they are being very picky of what they're going to grant. So, I mean, unless we have a wildland fire pop up next month, which, I mean, we could, who knows, they probably won't grant them.
Is there anything I can look at or print that tells me what I need to report? Just the fields, not the 52 pages of the report itself. So Amber itself will walk you through each piece of that. And that's why SAVIG and the other people have donated the money to be able to have everybody have access to Amber. So it walks you through the entire thing.
And the reason why that's 52 pages is because, you know, this phrase is coming up all over the place. You've seen one ambulance transport company, you've seen one ambulance transport company. The, you know, instructions are having to go through every scenario of private, for-profit, not-for-profit, rural, urban, you know, volunteer, hospital-based. So not every question is going to apply to your specific organization.
Yeah. We're so diverse that they had to go into that much detail. So here are the different sections, lots of different sections. General survey instructions, it goes on, and we'll go through each one of these as we go. It obviously follows the rules in the actual tool, the actual instrument.
I was going to say, before we do, just kind of give an idea, who's operational here? Who's finance? And then who's revenue? Okay. Who does it all? Who goes and buys the toilet paper?
Yeah, so we'll have a mix of things in the room. So please bear with us as we go through the questioning and go through the whole processing, because if you have volunteer labor versus no volunteer labor, if you have donated versus non-donating things, so there's going to be a lot of different questions. It looks like we have a lot of different types of people. So who in here knows that their PAYCOS is up to date?
Half of mine are.
If it is not up to date, please have it up to date before you submit the cost data collection. So go in, make sure it's all up to date. Not that they will look at that, but they could look at that. So make sure that all of that is up to date.
So the thing about Pecos, I tried to do that, but it's only a certain person that can get an account to get in, right?
Yes.
And I'm representing the fire chief,
Mm-hmm.
so they make it hard, that's what I'm trying to say.
They do. They do. Unfortunately, that's the way the system is set up. So if you can maybe get it switched to you. The other thing is, if you don't know who your representative on Pecos is, you need to find out. So we had a transition with us. I had to go and get everything changed. It takes a little bit of time to get it changed. It takes a little bit of work. So make sure you go in there and get that changed, because that's where the emails are coming to for the updates.
And I picked up the phone and called. You know, they're very helpful. They want us to be able to get in there and do this, you know, electronically, because it saves them. So yeah, don't hesitate to say, we've lost the person at our organization, or I don't even know who it is.
Yep. Can you tell me who it is so I can connect with them
Find
even?
them. Yeah.
And go ahead.
Provider enrollment. I forget what it stands for.
I just looked, is it an online Medicare enrollment management system?
That's who you enroll with for Medicare.
Or you do your revalidation.
Yes.
Them.
The Medicare portal kind of.
Yes.
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 Administrative access.
They call it, everything's an acronym.
Yes.
Just to make it.
What Robert Lawrence calls it, alphabet soup, I think.
Yes.
That's what it feels like.
So much.
So-
So you said all the emails go to Pecos, so
It goes to whoever is
It's
registered
registered.
with, yes,
what kind of emails would be going there?
your initial letter of, hey, you've been chosen for year 1, 2, or 3. Yeah.
Okay, and maybe whether your submissions would get.
And then that gave you the instructions of, here, go in and say, what, are you a fiscal year, or are you a calendar
Yes,
year?
And then
Mhm.
subsequent emails perhaps?
Yes.
Oh, yeah.
Oh, yes.
Validation required.
Mhm.
Yes. So whoever's listed on there is the one that's getting the emails and the mail. Because the mail will come to
Every
them.
5 years, ambulance services have to revalidate that they provide service, this is their area, they, you know, and it like sort of, I guess, re-registers their NPI and then in the system.
Yeah.
And hope CMS tries to, if they get bounce backs from an email, which happens in this industry quite a bit, or don't hear anything, they usually will send a letter. So, and then that, you know, however, we have had a number of services say, never got an email, never got a letter, you know, and that's why we're telling you it defaulted to your calendar year.
And make sure if you have more than one NPI that you're going in and updating it for all of your NPIs. So some people have multiple NPIs. You want to take this one?
So the section 2 is about your organization. So, you know, do you bill for ground? You know, what type of ownership are you? How many MPIs do you have? You know, who's going to be your contact person? And then, are you doing calendar or fiscal? And like we said, if you didn't specify, they defaulted you to calendar. And then, you know, which ownership best describes you: profit, not-for-profit, government, volunteer, public, private.
Good question.
Yeah.
Referenced being contacted prior to COVID.
Mhm.
We just got contacted like 2 months ago.
So were you picked for year 3 or 4?
Yes.
Yes, and
Okay.
they just released those in November, I
Okay.
believe.
And then we submitted all of that, but we've heard nothing since then.
So once you submit it, that's what they go
Yes.
Then
You don't get a response, no.
with.
No.
Good, really good
Don't
question.
hold your breath, you're
Really
not
good
gonna get a
question.
response, yeah.
Really good question. So the organizational characteristics, so if you're a fire department, police or public safety, or you're part of a hospital-based system, you're gonna have more questions. It's called skip logic in all of what we do. So they're gonna have questions that talk about whether you're sharing the information, whether you're sharing the vehicles, whether you're sharing the space for these ones. The other ones are typically straightforward. It's your organization or it's not part of your organization. So again, these are the ones that are gonna have that shared dual response. So Amber is a great tool. What it's going to do is it's going to do that skip logic. So if you get to a section and you don't have volunteers and it is asking you about volunteers, you have to go back to the beginning and re-answer these questions. And you can do that as many times as you need to in Amber. So if you're finding that you're getting questions that you're not supposed to be getting, go back to the very beginning of your organizational characteristics.
I just want to jump in here. I mean, we're talking about Amber, but I don't think we ever actually really explained Amber. So Amber is a software that the Ambulance Association created. We created it for two things. A, we used a little bit more simple jargon for us to understand, but B, we want to collect that data. Not that we don't trust CMS, because I'm getting away from Mike, we completely trust CMS. But if, when it goes to the MedPAC and the MedPAC report comes out and says, oh God, you guys should only be getting, $50 per transport, yet the data we're showing is, no, we should be getting 500. We can go and, have a conversation.
The other thing I found is when we got all of the grant money from the federal government, you went in to report on that and it tells you there's an error. Okay, where's the error? I have no idea. What's the error? I have no idea. Mine was decimal places. I didn't put decimal places in there and it kicked back an error. It took me hours to figure out what that was. This has built-in, we built into it to make sure it can find those errors and take you exactly to it and tell you why it thinks it's an error.
So what we're hoping, what we're wanting is everybody puts their data into Amber. At the end of Amber, we'll print out a report, keep that, and then we will have to go into the CMS tool, and Amber will say, in box 26, put this number, 27, do this. So it's just a autofill for us.
Any questions yet? I just want to make sure that we're pausing. Any questions on Zoom? No, okay. So as we talked about a little bit earlier, if you have shared costs, we're only reporting on ground ambulance only. We're not reporting on all the costs, we're only reporting on ground ambulance only. So make sure that when we're looking at each of these categories, ask yourself what's ground ambulance and what's other. So if you don't have other, great, it'll be a lot easier. If you do have other, make sure we're able to parse out that data.
Actually, you have a really quick question.
Yes.
How often are you putting your data into Amber?
Once.
Just once?
Yes.
That was my understanding also, that it was only ground ambulance, but there's a question about total responses, whether
Mhm.
you sent an ambulance or not.
Yep.
You might, but is it only for a medical reason? So if you sent an engine instead of an ambulance, what if you went to a fire? Is that total response include fire responses?
No.
Okay.
No.
Good.
Good question. Very good question. So I don't know if everybody online could hear that. It's ground ambulance responses only, and we'll go through that too. So again, this kind of shows you what we're looking for. You have the fire shared response, you have the ground ambulance, and then you have the shared responses in the middle, because some of your people are going to be dual purposing, right? They're going to be going on medicals and they're going to be going on fires. And you got to figure out kind of what bucket they go in and what hours they go into which bucket.
Is there any chance that this will ever get audited?
Is there a chance this will get audited? There's always a chance, right? So you're telling me there's a chance.
I think what is up, so, one of the things that we did with Amber actually this week is at the bottom of every page is a box for your notes. And as I was saying, you're not trying to trip you up. So that would be a great example of that would be is if you're a hybrid service, fire and ambulance, you're going to sit there and you're going to figure out like, okay, I'm going to give you a cheating way I would do it. And not cheating. I would sit there and I would go, I have this many responses a year, and this many are only fire, and this many are fire and ground ambulance, and then these are just ground. I would come up with a percentage, and then when I'm talking about how much my building costs or how much this, I would use that percentage to allocate that cost. I put in your notes what percentage you use. I truly believe this, that what they would do is most likely look at that number, and if it seemed off, they would just contact you and say, how'd you come up with this number? As long as you have some documentation, like, again, they're really not trying to trip you up. The other thing is that with so many services responding, as you know, and I took statistics 3 times, and I think my professor in college finally said, like, I never want to see you again. I'm passing you just to get you out of my classroom. But one thing I do remember is when you're doing aggregated data, you always throw out the highest and the lowest because you assume they're wrong.
Yep.
So they're going to, when they're aggregating all this data, nothing is ever going to come out about your specific service. It's all aggregated in the system. So chances of them coming right directly to you and going like, how could you put 0 down for facilities? Like, what are you operating at, you know, on a lawn, you know, is very slim. It really, really is.
Good point. So this kind of gives you an idea of the different types. So the ground ambulance expenses, the fire expenses, and those shared expenses. So she just kind of touched on
Yeah,
this,
right.
the allocation approach. So making sure that it's not a guess, making sure you're making notes, and making sure that somebody 5 years down the road, if we have to do this again, can explain why you're getting different data, right? So as things change, because we know things change in our industry, you may get different data the second time, but if you're using the same allocation method, you'll know that your data is measurable against the first round of data. Does that make sense? So making sure that you're making those notes. I told our accounting person, make sure that you're making a book so that if something happens to you, we can make sure that we can do this again. I see somebody giggling back there. Make a book, why you're doing it, where it's coming from, where you're pulling the data from, how you're pulling the data, what types of reports, because we all know reports can be very vastly different. So just make sure that you have that information, what exactly you're using.
So sections 3 and 4, service area and response times. So it's going to ask, what is your primary service area? And if you have a secondary service area outside of that, you can do this by a couple of different ways. It lets you enter zip codes, but it also is the next. Okay, so
I want to go to the Amber.
I know,
There we go.
thank you.
There.
It also has, Amber has a really, really cool tool that lets you draw your map, because, you know, you may only get half of this one zip code as, you know, your service area, and then the other half is your neighbors. Primaries, secondaries may overlap some. So I really like the drawing of the map feature in there.
And our accountant said that was spectacular because it grabs all those zip codes in your area for your primary, and then all those zip codes, you don't have to go and look them up.
Mhm.
But you are going to have overlap. You're going to have overlap likely with other service areas. That's okay. They know that's going to happen. So just because you and somebody else have the same zip code for that same service area for primary or secondary, they're going to overlap.
So now the response times. So they want to know, what's your approximate average response time in minutes for all levels. And then in your primary, and they also are going to want to know, what are you defining as your response time? Is it when the call came in? Is it when you went en route? And there's no right answer. It's just whatever your organization is using.
There'll be a drop-down menu on that when we get to Amber that you'll see, that you just pick what the allocation is, and then you put in your times from there.
And then also, are there shared responses? You know, are you picking up at the scene and handing over to an ALS unit somewhere else? What's your estimate of those?
And then they're also going to ask for your
That's
90th,
time.
yeah, your 90th percentile. So what's your best estimate of the shared responses in a percentage that take more than twice as long as the average response time reported in that prior question? So again, your accounting people, your number crunchers are going to be fine with this. People who are not number crunchers go, what? What are they asking? But those number crunchers, the people who you put in charge of doing these reporting, they know how to calculate that. So again, we kind of touched on those earlier. And then is your service incentivized to hit targets? Anybody in here have incentivization for? Nope. Okay, we'll skip over that. So volume, do you want to go through? Or pull them all up.
Okay, so now your volume. So the total number of responses in the reporting year,
Yes.
no,
Total number of responses is in the, until you report.
until you report, yes. We just had this answer clarified for us. So if your calendar year and you're not running your reports, you have to report by the end of May. If you're not doing this until May 15th, your total responses are going to be from January of 2022 through May 15th of 2023. And that's the,
Don't ask why.
I know.
So it goes through when you report. That doesn't mean we want you to report early.
Right.
We want you to report and take the time to do it right. But this says responses through the time you put in the report. So we were picked year 1 and 2 from one of us. And so we have our calendar year and we still haven't reported yet. So we're still counting the total responses until the day or within a week or so of when you
So
report.
that's a 17, could be a 17-month period of reporting.
Yes, for responses,
For just total responses.
only
Exactly.
responses.
Yes. Yes. We're not talking about,
Field.
yeah, not costs, not revenues, any of that.
Yeah.
And so that's regardless of transport or not. Then they want number of transports. We want number of, let's see,
Let's go back.
yeah, thank you.
Yep.
Um,
So total responses, then
then
ground ambulance response, right? So we have our total responses if
even if
we're,
you sent more than one, so if you sent a truck to it also, that's one response though.
with or without payment on both of those.
So now how many were transported? How many patients were transported? And then how many were paid?
This is not right.
No?
Is that right? Yes. How many were paid by the time the data is reported? So again, you're going back to those total responses that we talked about. The full year, if you're not going till May, all of that time frame.
Fully
Yes.
paid?
Just a
Paid.
payment
Paid.
made.
Payment made,
Payment
not
made,
fully
yeah.
paid.
Okay.
We know that we never did fully paid,
Right.
right? That's not a joke.
These are just numbers, not
Yes.
revenue. We're
Yes.
still on the, like, we had 100 calls. We went on 100 calls. We transported 50 times and we've got paid for 40 of them. Something.
So it's taking the big bucket, filtering it down, filtering it down, filtering it down. So look at it as kind of that filter. Your
Yeah.
question.
So we have a contract with Lifeline to pick them up at the airport and take them to the hospital and get the patient. And some of those are Medicare patients, but we're not billing Medicare. We're billing Lifeline. So do those count?
Still a transport.
Yes, yeah, we're not talking about, yeah, we're not talking about who's paying for it,
Yeah.
just that we transported.
That's a transport, but it would not go under paid transport,
The
right? 'Cause you don't
problem
get
is
paid.
that their insurance information isn't in the call because we're not tracking that. We're billing it to Lifeline. So,
But was it paid by them?
Yes.
Yes.
So it is.
So then it's a paid
Yes.
transport.
yeah.
Yeah.
So by the time you report, it has to go here if it's been paid. If you only did the transport but didn't get paid on it yet, it would go here and not here.
So when we get to the revenue section, there's a bucket to put those types of payments in.
Yeah. Well, I'll have to go back to every single one and see if that patient had Medicare, right?
No,
No, these are
Not
not,
Medicare.
no,
This is not
because
only
Life,
Medicare.
because
Okay.
Lifeline paid you.
Yeah.
Okay.
this is
Yes.
for everybody. So
Okay.
when we get to the, when we
I
get to
thought
that section.
I was gonna have to divide out.
No, 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 no.
Okay.
No.
Thank you.
Yes, much easier.
I'll sleep now.
We have a question in the back.
I have a question. If we are a fiscal year, do we look at 21/22 or the current fiscal year?
So if you were chosen for year 1 and 2, you start in your fiscal year in 22. And then you have to report within 5 months of the end of that fiscal year.
So if you're let's say your fiscal year ends June 30th, you would report by November. You have 5 months after your fiscal year ends.
So the collection year was last year for year 1 and 2. it's 2023 for year 3 and 4. So again, if you were chosen for year 3 and 4, and you have a fiscal year that starts July 1st, you start collecting data July 1st of this year and go into next year, and again, have that 5 months to go to report. Does that answer the question?
No, I'm confused.
So when's your
I was
fiscal?
year 1.
Okay, and are you fiscal or calendar?
Fiscal,
So when's your fiscal year? When do you start your fiscal calendar?
July to the end. of July.
So
Okay,
last
so,
July,
yes.
June started collecting data
Okay.
until June 30th of this
This
year,
year,
which
yes.
means you have until November 30th to submit your
Yeah.
data.
So I'm not late.
No,
No.
no, no,
You
no.
are, you are.
No, no one, at this point, no one is
Right.
late.
Okay, good.
Yes, because even if you were a calendar, we've got until the end of May.
There's still time for a flood.
Exactly.
All right.
Depending upon what part of the state, yeah. Another question.
For clarification, response time would be dispatch time to scene arrival, question mark?
It depends on what you choose.
Yes.
There's a drop down for that tells us which you want to choose, and whatever you choose, you go by that for your reporting. So some people may be from the time they're dispatched, some may be from the time they leave their station. There may be differences. Again, none of us do it the same, so they had to give us options. So here's a little bit of an example of kind of how this plays out in numbers. I'll walk through that.
So if we had 1,000 total responses, fire truck only went to 300, fire truck and the ambulance went to 350, ambulance only went to 350. So same thing, 700 responses were the ambulance, and regardless of if it was truck and ambulance, and then going down again, the number of actual transports was 100 were the truck and the ambulance, 300 were only the ambulance responded, and then how many of that 400 were paid at the time of us doing the reporting.
Clear as mud, right?
Totally.
So on the fire truck only,
So we're going to get that one out in that very first, we're going to add it in that very first question.
but what if, I know if they're going on alarms, that's included, but what if the fire truck's going on a medical call and it is?
So that's going to be the fire truck and ground ambulance.
Okay,
so-
so even though the grand, it's not that they're both there, it's either or.
Here. So if they're,
If they're only going on alarms, that's going to be your first question as part of your total.
Yeah.
Then if it's the truck and the ambulance going to a call
No,
together,
If it's the truck
truck going
on a
only
medical
to a
call.
medical call.
that's counted there as well. Yeah, it's going to be counted as a response.
So it's gonna be under the fire truck and or.
They're not going to break it down. What we did is break it down so you could see the difference between the responses. They're going to ask for one lump sum number of total responses.
Right, but
fire
if the
truck
truck is
only
only
could
going
have
to a
medical
medical and no ambulance is going to a medical.
Do they transport? Or are you meeting an ambulance there to transport?
No, they're lift assist.
Their lift assist? That's a response.
Yeah, then just the response.
So,
And what I would say is, this is where I think your notes are like the most important thing, is whatever you choose to do, just be consistent with it.
Yeah.
You know, if, again, as clear as mud, if you determine that that is a response that is medically driven, that is part of your system, just make sure that you put a little note in yourself that that's how you counted it, that that's really, I think, what matters more than anything at all, because when you start getting into the math part, they're going to be crunching the data and doing the division. What they're really trying to get to here is, which we argued for, by the way, is we respond to probably most services between 27 to 35% of all responses do not end up with a transport. And what we're trying to say to them then is, where's our revenue for that?
We're not
Like,
saying it
where's
all.
our,
Yeah.
so everything is based upon proving our need.
They can't hear. The last two people hear their questions. So this question.
I answered that. I know he said he couldn't hear the response. He could not hear the answer to our question.
We're a hybrid model right now, online.
Can we email them later? But yeah, we can have her pop up. Okay, thanks. Yeah, just if you can stand a tiny bit closer.
Yep.
That'd be great.
Yep. They're having a hard time hearing us online. So again, if you go back to the total responses versus transports, that's what Maria was outlining. You have the total responses and you have the transports, and there is a big gap between the two, and we don't get paid for that. We barely get paid for this, right? So what we're trying to do is show that we do a lot more than just respond with an ambulance, transport somebody and get paid, because that's not reality.
Go ahead.
So does anybody in here do standby events? Okay, those will be logged in here as well. So you need to know what your standby events. Nobody here does paramedic intercepts. That's a New York thing. We do joint responses.
It's not called a paramedic intercept according to
CMS. CMS calls those, anybody outside of New York,
I'm gonna do that. No, we don't.
an ALS or BLS joint response.
Yeah.
That's where that goes.
We all call them paramedic intercepts in our,
Yes.
in our companies,
It's
but.
one of those things where they send one guy to a little car.
So you'll have to record these as well.
So our service mix. So this is now where we're wanting to know, okay, we have our total counts. What were those counts? So,
Let's click to here.
okay.
That's an easier way to look at it, I think.
Yes, so they're wanting to know by percentage of how many of our transports were BLS non-emergent, BLS, ALS, ALS2, SCT, and they're just wanting percentages.
And then what percentage are inter-facility as well. So does everybody's billing system do this? Can you get these reports? Find out if we can get the reports, because they're going to want these percentages broke down. If they just do BLS together lumped, they shouldn't be, but if they do, you need to be able to pull those apart. So they need this information so that they can pull those right reports for you, or whoever's going to do the reporting.
What billing, what are you using for your?
Well, right now we use Andre's medical billing.
Okay.
So
They should be able to pull this data for you then.
Maybe I'm gonna ask them.
So if you go to this information, even if in the tool itself, it outlines all of the different categories. So they'll know, I need my data by HCPC code. You're speaking their language, they'll know what you're talking about.
We're switching July 1st, go figure, to someone else, but
The other thing too is if you're using a billing service and not, I don't want to say push, but there's a disconnect, have the billing service call us. You know, and we'll walk through it with them. Actually, we did one for Ohio billing just a few months ago. So please, because then we can hopefully translate for them what we're looking for.
So for those people online, Maria just said that if you contract with a billing service, have them call us directly if they have questions on this after sending them the information. So labor is going to be the biggest section of them all. Who in here has volunteer labor? There's a few. So we're going to go through these line by line, but I wanted to make sure that I wasn't beating a dead horse if people don't have volunteerism. So you're going to have,
Do we want to take, we've been going almost an hour. Do we want to take a quick break before we get
Yep.
into labor?
let's do that.
labor?
Yep.
So how about we take a quick break until like 10?
Yep.
And then we'll get into the labor section.
That's a really good idea.
So good, because my knee is starting to hurt. I might have to get a stool. I don't know.
So this was, so we were only notified a month ago, so we're in years 3 and 4. And we did our submission with the people that are doing fiscal year. So are we in Amber, or will they send us something
No,
later
Amber
to?
Amber is our internal
Oh,
system
okay.
that you can play with.
Okay.
and work with so that, and I'm just gonna say winner, winner, chicken dinner.
Okay.
Because I think starting when your fiscal year starts, looking at the data is so helpful.
Oh, right. Yeah.
Because, you know, you were, you know, like, because when we get into, for example, when we get into this section is all about what your labor look like at the start, not at the end. They want to know at the beginning of your fiscal year, what was your breakdown of labor? So can you imagine if you're just looking at it for the Christmas week? Whether you're trying to go back in payroll or whatever it is and
Well, yeah,
calculate.
because we are starting a program in July, but we're not gonna have hired by then.
Yeah.
So,
So already make your, you know, bucket, make your, you know, payroll, you know, factor that in so that you can separate within the program easily. So the amber should be on the, did we send that out or did that come from OSAA?
I'm,
For the participants?
they did it.
Okay, so Shelley should have sent an email out, a confirmation.
if not, go on ambulance, if you're not in it yet, go to ambulancereports.org and you'll see it'll say apply here free. Click on that. And then I have staff right now that are like literally back there sending emails to everybody in class going like, congratulations, welcome, here's your username and password. You're all set. Yeah.
I'll look back. I'm sure I designed the.
Well, then do you feel like we're-
There were several mistakes, Mark, that didn't get
You've
it.
never heard of it.
I get it. When I.
Well, and the thing is, you know,
Well,
the
I
last
did a-
time we had to revalidate, I can't remember, if it was either 17 or 18, you know.
Yeah, we're at
Like,
this fall.
like the world has, you know,
Right.
completely turned
Everything
topsy-turvy since then. I don't know, so.
Yeah. I
But
did it
yes.
2.5 years ago. I remember going through CMS revalidations.
That would have been in Pecos.
I
Yeah,
sat
because
on
they
the
would have directed you to the Pecos site to do it.
So you can get back in there and make sure that we're.
I have all
You're the
this stuff.
contact
I'm-
now, right?
Like I
Yeah,
said, just
I'm no legitimate
give them a
contact.
call. Yeah.
That's what you said.
Yeah, at least,
If you're right.
well, yeah. I guess I should say, I'm the one who said.
Right. Yeah, yeah, just, I mean, give them a call.
Okay.
You know, like I said, I had to remove someone from, you know, our Pecos last time to validate it. I had to do the, you know, 855B of remove this authorized person, add this one, yeah.
And then, like, forget the 855B, which has categories of, like, it's almost impossible to even figure out which, like, this is.
It is actually very simple.
One quick question, who's the carrier that's gonna be responsible for it? Is it Palmetto?
Palmetto's the one that we submit our calendar, yes, calendar.
I just wanted to make sure that people understood that even if you
Yeah,
have
don't go,
Meridian
yeah,
or you
don't
have
go to
whatever, they're
Meridian,
not the
look
ones.
for it.
Palmetto is the one.
Yes. But they're the map that won the contract. Got Bowen.
And then people ever listen in on those open door forums? Okay, CMS has an open door forum every other month.
And we've got
about
talked.
And just so you know, like, that's. a
And
good
you guys
place.
are, you know, by signing up, you're gonna be enrolled as a member of AAA. So
Yeah, we're part of it.
you guys already did it?
Yeah.
Or, yeah, we're going.
Yeah. Yeah.
And the other nice part is when you have people going through it, you also get the product videos that we went and did. So it goes section by section, instead of like an overview like this, it can be daunting for somebody to listen to. It goes section by section, so you can have them sign in to that part of the whole this package. And then they can go and you can say, okay, well, you're the billing company, watch this section.
Unfortunately, it is actually so little that the billing, you know, it is really the finance, it's really, you know, the service, you know, the operation stuff. And that's, I was gonna say, and that's, I was in Arizona, and that was the bonus that we found was that, yes, because There are used to.
A lot of.
So we will get notified about
You should have already, so.
I'll look back.
If not, yeah,
If
if not,
it's
just
true,
the.
I'll look back and anything else for sure.
I'm very well.
Yeah. It didn't all start. She's the one that was sending out all of the.
If not, I'll get.
Registered here.
If not, I'll check with her.
I just don't want to take this first time. So that's why. Well, text her. No, it's perfect. I don't want to be here hanging. You don't know you're fine.
And I'm a little bit, I'm not a stay in one place, so I really like the line. Everything's pronounced. Yeah. If I, well, this is the way, but.
I mean, the computer's really hot.
No, I know, okay, I just want to make sure I have it, right, to see that, or to see, yeah.
I figured that. I'm on the creative teacher right now.
Oh, did.
Yeah, like some of the calls will be only. So I never. I swear they do it.
No. I don't. She was so.
But, you know, he was doing stuff.
Yeah. All right, are we ready to get back started?
So.
All right, we're going to jump back in. Oh, I'm sorry. Yeah. I It's going to parse that out later. All right, we're gonna jump back into the labor section. Again, we talked about it being the largest section that you're gonna have to report on. So if you have questions on this, please make sure that you ask. And if we don't have the answer, we will phone a friend. So there's different buckets. You have 3 different buckets of categories that your staff are gonna fall into. It's EMT response staff. So your EMTs, your paramedics, your EMRs, your ambulance drivers, and people laugh at that, but there are ambulance drivers in certain areas. Don't know if you have them here, but they are.
I mean, yes, we can.
So we've said that to some places because in the state of Minnesota, we can't have them. And they're like, what are you talking about? People call us ambulance driver all the time and we stopped calling us that, but some places have it like you do. So that's where all of the response staff is going to go. If your CEO works on the truck 1 shift, they fall here. If your biller works 1 shift on the truck, they fall here. This is for anybody who has worked any labor hours on the truck. Does that make sense? So as a response person, their money falls here. Their category falls here.
So you only assign 1 category.
Yes.
So my husband's an ambulance driver and is training to be an EMT. So would you categorize them at the highest level? I guess?
No, we'll get to that.
Okay.
So they were asking, for the people online, they're asking about where to categorize somebody versus where they started the year and where they ended the year. We will get into that. Somebody else had a question. You had a question?
Schedule time on a trip?
If they responded to 1 call,
So if I don't like, so I run around in Canterbury, if I go on a call, but I end up jumping in the back of the ambulance, I'm not.
Yeah,
you,
that first
so
question.
if the person, so the question was, I run on a call, I jump in the back of the ambulance, even if you don't transport, if you respond to a call, you fall in this category. Another question?
So one of our stations, because we're small, we have, they jump from the engine to the medic unit. Just really depends on what call. I mean, I don't know how I'm supposed to keep track of that.
You'll have to kind of figure out a way.
All day long.
Yep, so for those online, they have somebody that jumps between fire and EMS, jump back and forth. You'll have to figure out a way to kind of calculate the percentage in there. That would be an allocation, and again, making notes on how you calculate that percentage. So how many were fire calls, how many were EMS calls?
Okay.
You may be able to parse it out that way.
Yeah, all of our people are firefighter paramedics. We have a few firefighter EMTs.
They're all going to do it, right?
Yes, dual roles are where it gets a little complicated, right? So, but they will fall in this bucket. It's just the percentage of time you'll have to calculate. Yes.
Sorry, I think you already said this, but are you only counting if the ambulance transport?
No, if they
No.
go on, they're asked, I did want to make sure I'm repeating the question for the people online. So if they transport or not, it does not matter. If they respond to a call, so if I'm an admin and I'm an EMT, which I used to be, I let it last, but if I'm an admin and I'm an EMT and I respond to a call that happens outside of our building, right outside of our building, I now go in this bucket. If you have responded to a call and have one of these certifications, you fall in this bucket. Yes.
For your entire year salary.
For the entire portion of your salary. Yep. So then you have the admin and facilities. So you have your dispatchers, your supervisor for dispatch, receptionists, billers, fleet management, custodians, you name it. You know the admin people, you know what they do. However, if you contract for them, they are not your employee. That's a different section. Does that make sense? So we contract for billing. That billing dollar amount does not go here. It goes under contracted services. If you contract for your maintenance, it does not go here. It goes under contracted services. Does that make sense to everybody?
So this is our W-2 employees.
So we're hospital based,
Mm-hmm.
so all of our people work for the hospital.
Yep.
Mm-hmm.
So that's part of,
They're still ours.
yes.
Mhm.
So you're a hospital-based system. All your employees are yours. They're W-2 employees, so they would not go under contracted. They would go under paid. Yep. Yep. And so then you have your medical director. How many in here know that they pay their medical director?
As a W-2 employee?
1099 employee. That's why I wanted to make sure that we talked about. You're contracting for that medical direction if it's a 1099. If it's a W-2 employee, they work for you. they go here. If it's not, they go under contracted services. So think about it as, do I pay them with a paycheck from us, like all of the rest of our staff? Or do I pay them as a vendor of some sort?
So we're predominantly volunteer, and I think we only have 2 W-2 people.
Okay.
So then this, we have to figure out just for those W-2 people.
Yours, because they're volunteer, will go into volunteer. They'll fall under that EMT response staff.
Okay.
Yep.
Okay.
Good question. So here's how to categorize your employees. Paid operations director with an EMT paramedic license, who occasionally goes on ambulance calls, is reported in the paid category in the EMT paramedic category, response staff. You have a paid EMT basic who volunteers for the organization in another capacity. Don't do this. Call Scott Moore. It's not legal. So here's some different ones. Paid EMT who performs administrative duties. What category? Paid EMT. Paid EMT who volunteers additional unpaid hours. Again,
We're not doing this.
we're not doing this, and if you are, please call Scott Moore. A paid administrator handling billing and clerical duties and occasionally vehicle maintenance. Again, they're going to fall in that administrative category. A volunteer EMT intermediate who becomes a volunteer EMT paramedic. They go in the category they started with your company or started the year. So if they start mid-year, they go at the place they started. I'm an EMT, I get my medic. Halfway through the year, I transition to a paramedic. I start as an EMT, I stay as an EMT. Does that make sense? Clear as mud. Volunteer EMT basic who became a paid EMT basic during the data collection period, they're paid. It goes the opposite. I know, I was waiting for it goes the opposite. So if you started paying them, they're paid. But where they started the year as a category is where they end. Again, clear as mud. Paid EMT paramedic with only air ambulance responsibilities, do not put them on here. This is ground ambulance only. So we like these kind of checklists, right? These algorithms. So did the person have ground ambulance responsibilities at your organization during the data collection period? Yes or no? Yes. Was the person a paid employee of your organization during any point in the collection period? Yes or no? If it's yes, you include them under the paid staff category, and then they fall in those buckets. If they were never paid, they fall in the volunteer buckets.
And you're excluding stipends. So if the volunteers get a stipend, it's not. Right?
Correct. Stipends will go elsewhere. Yes, you will report that elsewhere, but stipends go elsewhere. Good question. When we go to Amber, I see some frustration. When we go to Amber, it makes it very clear and it makes it very easy.
Because like I said, the smart logic, if you answer yes, it's going to take you to
the right
question that pertains to your previous one.
So here's a weird one too. What happened, like we have a contract with another fire district.
Yep.
To provide their ambulance transport.
Mm-hmm.
And occasionally we take their EMTs with us in the ambulance and transport.
That's theirs.
But they're not paid by us.
Right.
Right.
Okay.
So they're
That is
going to
theirs.
report that in theirs.
Okay.
Yep. And they need to report. Make sure they're reporting.
Reporting.
But they're not a
They don't
transporting
have,
agent.
yeah, they don't have an ambulance.
Oh, you're just taking them with we have fire that responds with us, and sometimes they drive for us, or sometimes they do something for us. We're not reporting them.
Okay.
Nope. So again, this is the algorithm. This is kind of how it's going to look on the screen. This is not how Amber looks. We'll show you how Amber looks so you guys get a really clear visual of that later. So tracking hours. I think that was what you were talking about in the back. Making sure there's a way to track the hours that are ground ambulance only versus public safety hours versus all other duties. So there's different buckets for their hours. That that relates to their total hours worked. So what you're going to do is you're going to look at so you guys, a lot of you in here are public safety. This is a really good representation of that. So you have that part-time volunteer EMT basic who only responds to ground ambulance calls, but assists in administrative duties. You do choose relevant without fire, police, or public safety roles because they're only doing it for the ambulance service. If they're doing it for both, you want to say that they are doing it for both, that it's a shared service. Paid full-time firefighter with no ground ambulance responsibilities does not get reported. Only somebody that has dual responsibilities gets reported. Make sense? So we talked about the skip logic. Skip logic for shared services looks like that one over there. It's going to give you the questions you need to answer and gray out the rest. Non-shared services are going to look like this because it's not going to give you those same questions. And this is the Amber system. So again, what we're trying to do is we're trying to make Amber give you the information you need to easily put into the reporting system through CMS versus trying to go into CMS, answer the questions, get an error, and have no idea where your error was. This will help filter all of that information for you.
I know you said that you only need to go into Amber once, but wouldn't it make sense to go in and do as much of it?
You can.
You can.
Yes, you can put in as much depth. So your organizational characteristics you can do now.
But you couldn't put in any of this other stuff like categorizing people? No.
Is your reporting period ended?
No.
So you have to wait until your
Oh, right,
reporting.
there's
right,
that one
because-
chance where
yes,
they-
If you've got
go
new,
back. Okay.
Yeah,
someone
what if
leaves, someone leaves, yeah.
Okay.
You have to wait on some of that. Yeah. But your facilities, your vehicles, your organizational characteristics, yeah, you can put all that in unless you're planning on buying something between now and then, and you can always go in and change it. So that's the other thing. If you don't think that something's going to change, that's okay. You can put it in there, but just make sure if it does change that you update it. So compensation, salaries and wages, overtime, training time, standby time, and it can include your payroll taxes. That's compensation in a nutshell. Benefits are healthcare, PTO, retirement, stipends, and life insurance.
It says annual compensation, but if we're on a fiscal year,
It would be your fiscal,
It's the fiscal
yes.
year.
Yes, it's your fiscal year compensation. So you'll have to have them pull that for you. And usually you're getting audited on that anyways, typically. So you probably have those reports somewhere because the auditors usually do that within a couple months of your year closing. So that you should be pulling those reports anyways. So this kind of breaks down. So you have an employee A who is an EMT basic. Their total annual compensation per year is $20,000. Employee B is an EMT paramedic. Their total compensation is $38,000. And employee C is an EMT paramedic for $42,000. So in the EMT basic, your total compensation is all of the compensation for the EMT basics. It's not breaking it down by employee. It's a bucket. For EMT paramedic, it's the bucket of EMT paramedic that goes in there. That's the big number that goes in there. It's the total of everybody that's an EMT basic, that's an EMT intermediate, or that's an EMT paramedic, or whatever category you have. That makes sense? So you're going to just be putting the big number. You're not putting individual salaries in there. Your HR will like that because they don't like to give out personal information like that to people who are doing this reporting. Or I'll do you one better. Have your HR person put it in. You can assign them in Amber and you can start assigning this stuff out.
How many of you are your HR person?
All right. So again, it's another example. Here's your hours. Again, you're doing total hours. You're not doing individual hours. You don't have to calculate each individual person's hours in line by line by line. They're asking for total big bucket hours. EMTs, EMT intermediates, EMT paramedics. Yes.
Did you already mention what to do if your employees see leaves in the middle of the reporting period? Do you count them or?
If they've worked hours during the reporting period, you count their hours.
Oh, so you put here what their compensation was or would have been, right?
Yep.
And then later on, you're gonna know how many hours
Hours.
they actually worked.
Yep. So what they're doing is calculating
Okay.
an hour per, a per hour rate for those who have compensation. For those who don't have compensation, they're going to figure out and calculate, they're going to use this type of data to calculate what a volunteer would make if they were working on an ambulance. So you see that the person had other duties. So you're not reporting the information that goes to other related duties. So the people who have, firefighter and paramedic, if they're on fire calls, you got to allocate those hours out. You got to pull those hours out and only be reporting on the hours that they worked as a medic or EMT. I think we're beating a dead horse.
I think we are too.
So we're going to move on. Hours worked. What do you include? No air ambulance? You're going to answer. What do you include for hours worked?
All hours.
Okay.
It's broken out into categories, right?
It's broken out into categories. What about public health responsibilities? Did anybody in here do the COVID vaccinations during that time period? Do you record those hours? You do not record those hours. Community paramedicine? Are they going on ambulance runs? Are they secondary on an ambulance run? Okay. So you're gonna have to figure those pieces out. So here's the volunteer labor section. So I know we have some volunteer people in here. How many individuals volunteered for your service during the data collection period, fiscal year or calendar year, whichever you chose? You got to stick with what you chose. What labor category were they in? Again, we go back to that beginning part where we talked about the EMT response staff, the admin and facility staff, and that medical director. Who in here has a volunteer medical director? Yeah, so their volunteer hours go here. It's not contracted, it's completely volunteer, correct? So their volunteer hours go here, so you're gonna probably have to ask them how many hours. My guess is they'll know off the top of their head. So how many total hours worked with ground ambulance operations only? And then how many total hours worked fire, police, or other public safety operations? So again, you're pulling that data apart for them. You're saying ground ambulance, fire also, and then total other responsibilities. Yes.
So our volunteers got switched to their own occasional part-time now. And so they have call time and then they get called back, but they're getting paid an hourly wage.
For all of it?
Not for all of it.
Not for all of it.
For call time, they're getting paid. And then when they get called back, they get more if they get called in. Are they considered paid? They're not full-time.
That's,
So their call time paid, I mean, is that a small?
It's like five, 60 an hour.
it's not a livable
Yeah,
wage. It's not a
right.
It's
normal
not a normal wage.
normal wage. So they would be a volunteer and that would be a
For those, yeah.
stipend.
Okay.
So volunteer number one, they work 500 hours during the data collection period, ground ambulance responsibilities only. So that's where they go. Volunteer number two had 750 hours during the collection period. 250 hours were community outreach. 250 goes in the total other responsibilities. We got to make sure that we're counting those other responsibilities as other responsibilities and not working the truck.
Could you put the COVID clinic times in there?
COVID vaccine would be
hour.
other responsibilities. Yep, they're not in that first bucket of working the truck. They're in a different bucket.
question.
Yes.
It says, are we allocating wages and hours by percentage if we have shared responsibilities?
So that would be up to you how you are able to parse out that data. Some people actually have a way to parse out how much data or how much the wages and how many hours are and separate that. If you're not, you got to figure out a calculation and a way to calculate that and allocate that appropriately. Make notes. So anybody that ever follows up and does this again would have those notes on how to allocate. Did that answer the question? I hope. Let me know if it didn't. So how many individuals were administrative or faculty volunteers in the reporting year? You don't include admin staff that have EMT responsibility duties. Remember, we're putting them in that response bucket. What are the total number of administrative or volunteer hours in the reporting year? How about those medical direction hours, which you have? And how do you provide, and do you provide stipends, honorarium, or benefits for volunteer labor? So that would be your question back there, paying them that smaller amount. It's not minimum wage. That would be under a stipend, a benefit, or an honoraria. There's your answer. I wasn't sure if there was a slide on it or not, but yes. So anybody who is not making minimum wage, it's a stipend, honoraria, allowance, or other compensation. It's not an actual paid employee because you have to pay people minimum wage. And if you're not and you're making them volunteer, call Scott Moore. Do not count an employee twice. So again, we go back to that, making sure that you know where they started in your roster. It doesn't matter where they ended. You know where they started in your roster. They start halfway through the year as an EMT. They stay as an EMT no matter if they move. If an employee transitioned from volunteer to paid, you report them in the paid category. And volunteer costs are reported in section 7.3. So don't double dip on this. Make sure that you're only reporting it in one area, one category. And do not report on outside contracted services. You'll do that later. So those, if you contract for billing, if you contract for your maintenance on your vehicle, if you contract for your medical direction, those go in a contract service area. So they don't get reported here. Yes.
So we're all volunteer, right? So we have a lot of people on the list, but there's several of them that don't participate at all for whatever reason. So do you not count them, or do you have to count them and then just put 0 for everything because they didn't do anything?
I would make my life a lot easier. And if they had 0, I wouldn't even think about it.
Yeah, okay.
Right? Because you have this list of what you need is those total number in the bucket. So if they haven't worked at all, they haven't done anything at all, no training, no nothing, don't worry about that number because you're going to have a 0 there anyways.
Okay.
Yes.
Thank you.
So we're a fire and EMS that just merged. And so, technically, if our staff had started out as paramedics, but they're transitioning to firefighter paramedics, which categories would they?
When is your reporting period?
We're in year 4, so technically,
This year?
yeah,
Fiscal or calendar?
that I don't know, because I just started back up about a month ago.
So if it's fiscal, you're in luck. It's a lot easier. Right? Because your fiscal year usually starts halfway through the year.
Right.
If you're a calendar year, they're going to start as but I think we're getting way too deep in the woods with this because they're a
still gonna be
paramedic.
Paramedic, exactly.
You're going to put them in the paramedic bucket, but for that second half or whatever amount of hours that they're working both, they're working dual, you're going to have to figure out how to parse out that.
We'll have to do the percentages for the one and then percentages almost for another one and then
Yes.
hours on the percentages.
Yes.
Okay.
Yeah.
Okay. Thank you.
Yeah. Good question. So section 8 facilities. You want to do facilities? Sure. All right. Give you that.
So this is our facilities, and it was updated this last January. So we want to include anything that is totally ours or partially ours that's attributed to only the ambulance, the ground ambulances, and no contractors are going to be part of this. So I got to move differently because I have, lovely vision and I can't read the computer. So I have to stand over here, which means I can't do the mic. So the facilities, it's gonna ask for, if you have multiple, your facility name. And this is just for you, if you have station 1, station 2, station 3. And then of that first facility, do you rent? Do you own? Do you lease? If your organization or another entity owned the facility and made the mortgage or interest payments, that's that next section. Your organization or another entity owns the facility outright. Facility was donated. No costs, including maintenance, utilities, insurance, or taxes are part of that. What is your total square footage of the facility? And then the percentage of your facility square footage related to just ground ambulance. So this is just wanting basic demographics on your facilities. And you need to do it, like I said, if you've got 3, you need to do it for all 3. So kind of a visual breakdown. Fire trucks are a lot bigger than ambulances. They're going to take up more square footage in the garages. So about 25% is for fire operations, for ambulance, and then 75% is for fire. But then looking at your staff break room, your conference room, any offices, training rooms, that sort of thing, they're used for both. So this says all rooms in this building are used for both ambulance and fire operations. However, 70% of the organization's responses are ground ambulance. So, go use 70% of that square footage is for ground ambulance, and then 30% would be for the fire.
Make notes.
Exactly.
Make notes on which way you use, because the next person coming in might not know. Make notes.
So then annual lease, mortgage, and other costs or ownerships of the facilities. So the facility name, if it's rented, if it's owned. So this is saying if it's owned, and section 8.2, do we have?
That's about depreciation.
Okay.
So you have your depreciation that your auditors do each year. They have a
Oh,
depreciation schedule for you. So your depreciation expense would go here. You don't have to calculate that. Your auditors do that for you. Ask them for that.
So some of this is going to possibly have to go to city auditors to ask them those questions. Yes.
The administrators will have access.
Yeah, but we're seeing some frowny faces out here going, oh boy.
So again, give them access to this and say, I don't want to have to do this. I don't want to have to pull this. I don't even want to know the numbers. Just put them in for me. I'll give you access.
Total acquisition cost if purchased outright during the reporting calendar year. If owned, payments, annual mortgage interest, bond interest, or other costs of ownerships, including payments against principal, if annual depreciation expense not reported. If owned and no cost reported, no annual costs of ownership, excluding maintenance, utilities, insurance, and taxes for fully owned or donated facilities.
So if somebody gives you a facility, pays all the taxes for it, pays all the utilities for it, you check that box.
I wish.
Who in here is lucky enough?
I was
to
going
have
to say,
that?
I wish.
See?
What?
All right.
One. Okay, so 1, you're easy. Everything else, you're not. So just example. Yes.
So we're in a situation, we're part of a community services district, so we have a facility. And our question is, since the service district is performing some tasks, do we include their square footage? Or,
You use
and
it.
let's say 90% of our calls are ambulance.
Are you using that square footage at all? Or is that just carved out for them?
Well, they perform tasks for us in that building. None of them are EMTs or firefighter administrative tasks.
And it's their building or your building?
It's their
Do they do HR, billing, accounting?
Okay,
That umbrella, is that what's happening in that building? Allocate. Will you flip back a few slides? Here you go. So you see the offices, the conference room, that break room, all of that. You can use this allocation method if it makes it easier. And when you do that, make sure you note it. Make sure you note it. I'm gonna hound on that, because if they think that they're using the space allocation method versus the response allocation method, they're gonna do it differently next time. So this is how you would calculate that. So if you have HR under there, the administrators, the billers, the accountants, the people who do the front end office work in there, this is how you would allocate. Yes.
so just a scenario, fire-based organization's got 4 facilities. You own 3 and you rent 1. Your organization does not depreciate the facility costs. So your fire station, your admin building, garage number 1, garage number 2. So for your fire station, rent or lease, no. Mortgage, no. Owned, donated. Same thing for your administrative building, your garage 1, and your garage 2. So these are just the answers you would do for each individual if it was the scenario.
So again, it's going to ask you the percentage for ground ambulance, and it's however you're doing that allocation method.
Space
So
or calls.
If you look here, garage 1, it looks like 100%, right? Because you only have ambulances in there. So you have 100% attributable to ground ambulance. Here, they're saying 50%. I would not
I wouldn't say
say
50.
it's 50% because that truck is going to be a lot bigger than this truck, unless you have really large ambulances. So again, however you want to allocate, just use it that same way going forward.
So insurance, maintenance, utilities, and taxes. Facilities insurance, your maintenance and improvement, any utilities you've paid, any taxes you've paid. So the total facilities related insurance costs for your reporting period. And then you're going to enter your dollar amount. And then if it's shared, you're going to enter what percentage you're sharing. Did you choose space or transport volume for that? Your total facilities maintenance and improvement costs for your reporting period. Don't include any of your labor costs that you've already put in your labor section. So just your facilities, your maintenance. You know, the wall fell down, you had to, rebuild the wall. The supplies for that, not if you had your EMTs do it, not their labor hours. Dollar amount and percentage. Then your total facility utilities costs. And then your total facilities taxes for that calendar year reporting period. Do not include any taxes if it's been in the mortgage section.
So some people can parse that out and some people can't. It's like our own mortgage payments. Sometimes they roll it in, you can put it under mortgage. Sometimes they don't, it's broken out. You can pull them apart, put them in 2 different sections. And don't assume that people understand that if you're only a ground ambulance service, that it's 100% on these, because my accountant came to me the other day and asked that question. What are our shared services? What are you asking me about? Because I don't understand. We're 100% ambulance. So just make sure they understand that if you are an ambulance service only, you don't have shared, because they're not going to understand what that means. So we're speaking a different language than they're speaking. Make sure that the language crosses over.
So multiple NPIs. Who's got multiple NPIs in here? You don't count. I don't count. Okay. So are they all underneath one location? So then you're going to have to, okay. And do they all share the 4 locations, or this NPI is at these 2 and this NPI is at one, and then you've got some shared.
Ambulance has its own, and all our clinics have theirs, the hospital has theirs. So,
Okay,
we have 4 ambulance locations.
for ambulance NPIs or only one ambulance NPI?
They'll make it a lot.
Yes,
easier
very
for
much.
you. Some places have an NPI for each base.
I don't think so, I think it's all under one.
Okay. Vehicle costs. So how many ground ambulance vehicles do you own? Do you lease any of them? So on your own vehicles, did the vehicle transport any patients? You know, did you get it on the last day of reporting and it never went on a call? Was the vehicle donated? The amount of the annual depreciation for it? Did you remount it in that reporting period? And what was the cost for the remount? This is what the questions we're going to want to know. So
What does remount mean?
We do it. We take that ambulance, send it in, they take that box off, they redo the inside of the box, they put a new chassis,
Oh,
bring it back.
got it.
It's cheaper.
Yeah.
Saves us about $100,000
Oh.
per truck.
yes. And if you don't know, go talk to JD Featon because he will talk to you for hours about remounts. He loves remounting. He is a master of remounts.
We remount like 3 times before we can't remount
Yeah.
anymore. It just saves a significant amount of money if you can get the chassis, which has been the problem, no matter if you want a new truck or a remount, right? You need the chassis, so.
Oh, did you want?
Nope.
Okay. So for your leased vehicles, did it transport any patients? And what's your total leasing costs for the year? And so break it down, you know, if you're leasing 5 ambulances, 3 ambulances, if you own 2 ambulances and you're leasing 1 ambulance, you're going to need both sections filled out. And then, so none of us have any water. I actually just found out that Alaska is the only place that has a registered water ambulance.
Yeah.
Just a little. So, like I said, you own 3, you lease 1. Here's the scenario. Yes.
Own is in no payments left on them, or
Own
Own
is
is-
in purchasing. it.
Yeah.
okay.
So, yeah,
Finance it.
whether it's financed or not, and the cost of that vehicle, whether it's leased or not, and the cost of that vehicle. So it's only 2 buckets. There isn't a, payment plan, how much you owe left. They don't care about that. They want to know how much it costs. That's the big thing here, right? How much does it cost us to do business? How much does it cost us to be ready? Yep.
So just a breakdown, your land ambulance owned, yes, leased, no. Did it transport patients? Yes or no. Donated? Yes or no. So this one was donated. We own it because it was donated. The annual depreciation cost for that, there was no purchase cost because it was donated. Any other costs or titling fees, that sort of thing. Remounted, yes or no, and then the cost of the remount. Same thing. And our water ambulance. So here's non-ambulance vehicles. So these might, these are our flight cars, trucks. They're not actually doing patient transports though. And so we want to know all of the costs for these too. What type of vehicle was it? Was it used to respond or support ground ambulance? Was it donated? The amount of the annual depreciation or acquisition costs, mileage attributed to the ground ambulance support for it.
We in here can track if they have a response vehicle that does both fire and ambulance, their mileage.
Yeah.
So
How much
attributed-
mileage only went to those ground ambulance calls versus what?
Again, I'm gonna take you way back to when we started, right? What's the allocation method you use for the people? How many responses? You can use that allocation here. So if you know your mileage, you can allocate, note it. Just make sure you put notes. So don't overcomplicate it. Look at it big picture. What they're trying to figure out is how much it costs us to run an ambulance service. So the mileage is part of that.
Although that assumes it goes out on every call, which it probably doesn't. If you use the percentage,
So you're saying somebody might take it home with
no, they
them?
might not send a second engine or a squad car out with the ambulance. Only some of the calls do. So you can't just look at the mileage on every vehicle and apply your percent. You really need to know, did it go or not, right?
Not
I think you can use an allocation
Yeah.
method. So if 70% of the time it goes on ground ambulance, 70% of those miles go here.
And so that's, if it didn't go at all, its mileage is going to reflect
Yeah.
that. It's going to have small, mileage.
So for like fire departments, again, 70% they go on, 30% are fire, 70% of those miles are probably attributed to ground ambulance, 30% are for fire.
So same thing, same questions we just did, for these, was it owned? Did it respond to calls? What type of the vehicle is it? There's a pull down menu for that. Was it donated? What's the annual depreciation?
And here's those other loan costs that
Uh-huh.
you were asking about earlier, will be in this section.
And then what percentage of this vehicle was attributed to ground ambulance?
These are leased.
Same thing. So scenario, does everybody understand this? Do we need to hit the scenarios? Yeah. So you've got a fire truck. You own the fire truck. It did go on calls to support it did go on medical calls. It was not donated. Your purchase cost was $0. Your other annual costs for the ownership, the percentage of calls that it went to just the medicals, not the fires. Same thing, fire truck number 2, it was owned, not leased. Yes, it went on medical calls. This one was donated. And this one went 67% of the time. Chaser car. Yes, it's owned. Yes, it went on ambulance calls. No, it was not donated. So here's our purchase cost for this vehicle. There's no other costs for ownership. And this one went 100% of the time. This was an ambulance, sorry, not the chaser car. And then water rescues.
Sorry. So fire truck number 1, you say it's owned, but there was no purchase cost. Is that because the annual cost is $30,000? Is that a payment?
That's your payment
Yeah.
plan. Yep, that's your bucket of payment plan.
So is the purchase cost just if you purchased it during that reporting year or back whenever you bought it?
When you purchase it in the reporting year, the purchase cost goes here if you paid the entirety of that purchase amount. So if you have a payment plan, it goes under the costs. If you purchased it outright, it goes under purchase price. So we buy them cash. We don't have payments. Our whole amount is gonna go in that purchase price. You guys have payments. You didn't buy it in whole. That amount is gonna go under the annual cost of ownership.
If it's a grant.
It still goes here. You'll report your grants later. You gotta tell them what kind of money's coming in.
So yeah, if it's a grant and we pay 25% of it.
Did you
So
purchase
you're-
it outright? So it's a grant. I hear you.
With your grant.
Don't
yeah.
forget that there's a grant there. You purchased it outright, you paid cash for the entirety of the vehicle?
Yes.
So you purchased it outright, that entirety goes under purchase price. Grant money, they'll calculate later into all of this. So you don't discount anything from a grant. You put the full amount of the purchase in here, and then you're gonna report your grants later. They'll take that into account, believe me, they're not gonna leave any money off the table.
So registration costs, licensing costs, insurance costs. Maintenance and fuel costs. So the share of maintenance costs attributed to ground ambulance by percentage, your fire trucks, rescue vehicles, any other vehicles that are responding to emergencies but are not transporting patients, and then other vehicles. So all by percentage, based upon like what we talked about earlier, your per allocation, thank you, of fire versus ambulance. Same thing with your fuel costs. What was attributed percentage to ground ambulance, your fire trucks, land rescue vehicles, all other vehicles. Do you guys have your own tanks? Do you go get gas, diesel? You know, I mean, it may be easier for some if like you're going to a CFN and you've got a card and that card lives with that truck. Well, you know that truck is just for that card. So it sounds daunting sometimes, but like you can logic it out.
So ours, when we go get fuel, it's tied to our ID card
Mm-hmm. But you could be in any vehicle then, right?
and any,
So then you're going to have to go back to the very beginning, the allocation of what's your responses. You know, same thing, your mileage, you know, look at your mileage.
So again, don't overthink it,
Mm-hmm.
because it's easy to go down rabbit holes, because that's what we do as medics and EMTs, as responders, right? We go down rabbit holes and try and figure out what exactly that we're looking at. What they're doing is they're saying, we have this big bucket. I'm a fire department and I run ambulance. How many of those calls are ambulance? How many of those calls are fire? And then you can kind of narrow it down. It's our best assumptions. We're doing our best with what we have, because some of us cannot pull that data completely apart. So we're doing the best with what we have. I would recommend going forward that you may change that so that you can allocate this differently in the future. Does that make sense?
yeah, I'm thinking now, we maybe have our unit number assigned, like when we have to put it in.
Mhm.
There might be like a report.
Right,
Yeah.
exactly.
A unit, yeah. Do you want to let them know that? The unit number, just so that they can hear it online.
So online, one of the options we're talking about is having your unit number be used when you're getting fuel. That way you know what vehicle it was assigned to, and it will be helpful to allocate the cost that way.
And honestly, number of people like this stuff. They like to do this stuff typically. Like I give these questions to my senior accountant and she's like, oh yeah, okay. I'll do a pivot table and I'll go in this direction and how about this? So they do typically like those types of things. They like spreadsheets and pivot tables and I don't. So I really like that I have somebody that does.
So question, I have an in-house fleet management program. Do I report my fleet manager and staff time under vehicle costs, section 9, or labor, section 7?
What do you guys think?
Labor, they're W-2 employees.
So even if they're in a completely different department, we need to figure out how many hours they worked on our medics and then report that.
Yes, yes. It's that shared labor, the shared services. It's terrible.
This goes back a few slides. I made a note for myself because we have our volunteers get W-2s
Mm-hmm,
because they get paid per call.
mm-hmm.
So they're not really volunteers.
Right.
But
But are
don't
they
ever go
making a
on
minimum,
ambulance.
are they making a minimum wage?
No.
Yeah.
So
So they
that's
are
volunteer
volunteer,
stipend
right.
For them, okay.
Really good question. Okay, so this was the in-house fleet manager maintenance report, fleet manager and staff and the labor costs in the admin facilities category, then report the maintenance costs for those vehicles are going to be under section 9, under the vehicle costs.
So the parts versus the person.
Now, if all maintenance is outsourced, then everything associated with that is going to be underneath our costs, nothing under labor.
Contracted costs.
So we have an in-house billing team and do all of our own billing. We're going to report the billing team under our own labor in the admin and facilities category versus we're contracting our billing out. So that's going to go in section 11. We don't have any labor. It's going to go underneath our contracted services section.
Before you leave that section, I know there are 2 templates available that can be used for uploading into the
Mhm.
portal.
Mhm.
Does Amber support the use of uploading? If we choose to use a template to collect that information? Because, I mean, purpose of Amber is to check things, right?
Right.
So
Yes.
if I'm going to import my template into the portal, I'd want to be able to import it into Amber.
I don't believe you can import the template into Amber, but how many facilities do you have?
Well, we only have 1 facility and we've got 1 ambulance. I mean, it's not a big deal for us.
Right,
but
right.
For other folks, they wouldn't be able, they'd have to manually enter it into Amber and then they might choose to.
I'll double check on whether you can upload that into Amber or not on the template. Templates were created so that people who have 30 buildings and 50 ambulances don't have to type each one of those in. Well, somebody's going to have to type it in somewhere, and then you can upload that, but it creates a way of double checking that, right? So that's what the template was for. So if you have a large number of buildings and a large number of vehicles, that's what the template was for. But I will double check and see if you can upload that into Amber. It's a good question.
You want to do 10?
Sure.
Okay. My niece heard.
All right, so equipment, consumables, and supplies. So we're going to go back to the very beginning and talk about shared versus not. We have to be able to parse this out. We're going to talk about annual depreciation, maintenance, and service costs. So you have your equipment, consumables, and supplies, but some of them are depreciating, right? So you have your cots, your monitors, these larger ticket items that are part of taking care of the patient that are going to depreciate. You're going to need a depreciation schedule for that, and you're going to need to make sure you have all of those costs put together. So that's that capital medical equipment. Consumables and medical equipment. Does anybody in here have donated consumable medical equipment? Your Band-Aids, your IV, you have donated.
The hospital replenishes our supply.
You pay them for that. It's donated.
I don't think so.
So you'll mark that you had donated medical supplies.
Anybody receive any gowns and masks? Yes. Right. So, but was it during our reporting period? Are you still receiving it now?
So you're going to put the costs here of these items. And then medications. They're going to ask a question about medications. Does everybody in here carry medications? Some services don't. So it's going to ask that question. And then it's, if you say, no, I don't carry a medication, it's going to ask you why. I don't know why that question is in there, but it's in there. So
Support big pharma. Yes,
yes, yep.
right.
That's actually a good point. Oxygen is a medication. So if you're not carrying oxygen in your ambulance service, they might want to know why. So non-medical. So you have all of these other pieces. We know what medical equipment is, but what's non-medical equipment? Non-medical equipment is your computers, your printers, your office equipment, your desks, your all of the things that it takes to run an ambulance service that isn't going on the truck and out. And when I say in the truck and out, I'm not talking about your computers. Your computers are part of this because they lump computers in as one lump sum. So your cot, your monitor, the things that you use to care for the patient are the medical. The other pieces are the non-medical. So your computers go with this.
So do you have a laptop or a tablet or something? Or
On the ambulance, we do.
that's what, yes.
That's non-medical equipment. I just want to make sure that there is that clear definition between the two. Medical equipment, I'm hooking up to the patient, I'm caring for the patient, I'm strapping around the patient. Make sense? So I go back here. So you have equipment, consumables, and supplies, and some people for the medical, like we lease our pumps. So we'll have lease expenses here. We'll have maintenance expenses here. That's all the medical stuff. Non-medical, capital equipment, uniforms, all of that stuff goes here.
Would you get down to all, like even the printer, the paper?
Yes. Yep, that is
office supplies.
non-medical equipment. If it's used for ambulance, if it's shared, again, you're gonna figure out your allocation method and you're gonna split that up. So you guys probably have administrators that work in the office and they use paper and they use ink and they use computers. There's a percentage of what they do that is attributable to your ground ambulance operation. There is a percentage that is not. So we're only reporting on something that goes with the ground ambulance operations. And uniforms go here under non-medical. To me, that's odd, but it's the way it is. All right, so section 11, other costs. This is everything else that we haven't discussed. So your billing service, if you contract, your accounting service, if you contract for that vehicle person, the dispatch center. Now, this one gets dicey because some people get their dispatch donated to them. They don't pay for it, right? Anybody in here not pay for their dispatch? Yeah. Check into that and see. Because that is a contracted, we pay for our dispatch. So it's a contracted fee and they charge a lot of money to dispatch. That facilities maintenance. Now we're talking about these outside vendors that come in. We're not talking about your individual employee. We're talking about that outside vendor that comes in to do maintenance on your building. Change light bulbs, the cleaning crew, all of those things that you pay them, it's their business.
What about if you have the city charge you a central service charge for, it's a city employee that does it.
But they charge you for it?
They charge us a central service charge annually for the use of that.
For use of that employee.
That sounds like a contracted service to me.
Within our own city.
That sounds contracted to me because it's a contracted negotiated rate. So I would put that under here.
It may not
And
be
I may not-
negotiated. It may not be negotiated, but.
Fair, but it may go under other. So it depends on what they're doing. So if you have it just for your vehicles and just for your facilities and just for, if you can categorize it, pull it out. If not, it can go in.
HR, facilities, they're all in that.
That would go here. Yep. Because that sounds like a contract to me. Who in here, you have a question?
I'm just trying to piece through that dispatch. So our city owns our dispatch. We don't get a fee for service because it's within our city, but so is that gonna be an allocated labor for us?
That's going to be a labor for you.
Number of 911 calls per day versus how many?
Yep. And your dispatch center should, I use the words should, be able to pull that apart for you. Yep, good question. Who in here actually contracts for their labor, their EMTs, their paramedics? Some places do that. That would go here. So make sure if it's a contracted service, it's not in labor and you're not double dipping. So if it goes in that labor bucket, it stays there. You don't put it here. If it's not in that labor bucket, you put it here. You're going to do the dollar amount, and then you're going to do the percentage attributable to ground ambulance only.
Would training costs go in this as well?
Training costs for your staff go in salaries and wages. Yep. So then again, you have all of these other expenses that we know we have. Biohazard waste removals, fees to physicians that oversee paramedics for the quality assurance program. Some people have those. Travel other than for training, dues and subscriptions, subsidies that you pay, funds paid to non-transporting agencies or medical staff, board of directors, advertising, events or meeting costs. So you have all of these other costs. We want to make sure that we capture every cost that goes into running the ground ambulance, because once we get to revenues, that's where they're going to merge that information and find out how much it costs us. So make sure that you're really, really detailed in how much you're looking for, because we want to make sure that all the costs get in here.
Does anybody else have a situation where your fire department is part of a community services district? I mean, we're not a city, we're
Right.
unincorporated, so technically, we're part of the community services district. They have a board of directors. So do we have to look at the service district's things and then figure out what % of that might have been related to ground ambulance?
Yes.
I would, yes.
Yeah.
Yes.
I mean, because,
Well, then
so,
it's
but,
not.
you know, the whole point is, we are trying to show how much it costs for us to run a transport. I mean, and yes, you know, for the rural ones, you know, as we said before, it probably costs a lot more per transport than it does for the urbans, because you have to have such, you know, it's a greater distance to travel. I mean, you know, it's more expensive to purchase things out in the middle of Oregon, we know, you know, so.
So there's a fellow at the district who might do some maintenance on, not the ambulance, but other vehicles that might go out.
That are
on call.
attributed to the
So
calls.
he's a W-2 person.
Mhm.
It's not a fire department person, but we're part, so you would count his labor, right?
Mhm, mhm.
And then this is where you'd say, I think there was.
This is contracted. That's not
It's
contracted.
not contract.
That's labor.
Yeah, he
Yeah.
would be in labor.
Okay.
Yep, that's your labor.
And I will, you know,
Okay.
I'll do another plug. hello@ambulance.org.
That's all you have to, you have a question like that when you're sitting there trying to noodle through this,
Mhm.
just put in the email, hello@ambulance.org, and one of our faculty, they all get the question.
And a couple of them are lawyers, so.
Yeah, you know, and they'll respond.
Okay.
You know, because again, you see one ambulance service, you see one ambulance
Mhm.
service, and I love when we get into the Q&A at the end and you just hear, you know, like, so, you know, what do we do about the fact that, like, we have a board that oversees all of public safety? Okay, so you have to apportion that out. Where does it belong? They can help you with all of that kind of stuff.
So again, other costs, section 11, you're going to give a source, the dollar amount, and the percentage. So this is kind of that other bucket that, well, I didn't answer it anywhere else, but I know there's a cost that we pay for this. There's something that we have to report here. It can go under other. That's okay. If you can't find another spot to put it, you can put it in other. And then it's going to calculate your total costs at the end. It's going to give you a nice number. It's not going to match the revenues, but it's going to give you a nice number. Revenues. I'm going to let you do this
So
one. This is your
revenues.
wheelhouse.
Yeah, we can take.
Yeah, we can. Yeah. Back at reporter off there.
The rest of them are pretty good.
You make it a little tiny bit warmer.
Oh, right.
I know.
And all of our guys are the enforcement. You're gonna.
Taking breaks.
I know you will. No, not yet.
Yeah, I mean, they should be like.
Yeah, so maybe I do need to now pay attention. You know, it's a field in the billing, but I just, yeah.
Or.
That was back when we got them.
So like, so I mean, until three, but you're right, I need transport then. And I can get it out of building too.
If they go, they have no insurance or ambulance overhead, higher balance. So we're looking at changing that to where 50%.
Something's wrong with that. When they quit transported by, yeah. When those engines were
Yeah. Oh, that's the end. And we have college, yeah. Oh, yeah, that's good. I know. I live in Hindsight. I know which is. Right
already a question, or did Michelle already ask? Does Amber City have voted the facilities and vehicles?
How they do it. And if it doesn't, I'll make it.
Right.
So my first few months, I literally worked one day. Fire, yeah. How long have you been in Yeah.
Oh, I know, Sean just said it's like 90 degrees in the men's room, so.
Yeah, that's where you go.
Meeting is there.
All the kids.
So, you know, when I was working with the high school kids, and we'd be at these, you know, gas station, truck stops at night, and, you know, the girls line is always like down, you know, and like finally, someone stand watch, we're going to the boys, like.
Taking it over.
So can you go in there and do the old?
Yeah.
Yeah. Right.
I know. Why is it all? I'm so tired. I just started to fall asleep and I think.
I'm sitting here. Yeah, like I'm like kind of here, hey, part of it. I'm just awful right now. And I don't know. I'll be okay. I just want to get it done. Love you, Mom.
Don't want me. You kind of know that, like. Like, really? Oh, no, you don't feel it. You don't feel like it's.
Thank you. Yes, no, absolutely.
And it has nothing to do with this. I used to be president until show up. No, I'm not like. Okay. Question about,
Oh, okay, good, wait, I was hoping that's what you, I so, yeah.
I'm out of Portland. All right.
whoever you spoke to at West Point, she did bring her. And so, we were. Well, we could tell. Disjointed information from the nursing home. We haven't had we extended like.
All right, thanks, Matt. We'll talk about it. Or pass over or whatever.
Perfect for some people or.
Yeah, right, you're lost.
No one will ever see it.
Yeah, I have to do the same about it. We really need to have a conversation to kind of understand what so far the people we're talking really are assuming for we just have to.
Okay. Are we ready to get started again? Okay, we're going to get started and we'll try to go through the revenue section and then we'll break for lunch. And when we come back from lunch, we'll go through, we can actually pull up the Amber and look through what those screens are like. I'm gonna wear my coat because it's cold.
Keep it out of the way, not fun information.
Okay. So revenues, yay. Now, everybody here's just got one MPI associated to ground ambulance, so we don't have to worry about that. So this is going to be slightly different than when we were talking about the transport volumes. This is going to be revenue received for that collection period, not up through when we're going to do the reporting. So your fiscal year is January to December 31st or July 1st to June 30th. That's the period you're going to be collecting your revenue numbers. Okay, it's different than the volume numbers. I don't know why, because it's not going to line up at all. But No one has any air ambulance, so don't report any of that. And make sure you're not reporting the revenue from different sources twice. So if your life flights, we don't want to report that as insurance revenue and also revenue from contracts, that sort of thing. If you can't exclude treatments, no transports, include that with your transports. If you can exclude those, you're going to report those in question 5. Does anybody bill OMAP, DMAP for treatments, no transports? Yeah. Mm-hmm. Your aid calls, your refusals, our Medicaid pays that. And, with the COVID, we got a very good deal for that. So if you're not, then you may want to look at it. Here's my revenue hat, because Medicaid's paying the ALS payment for that allowable for 2062. Okay, so we want to report revenue from all sources for our organization. Include revenue that is not related to ground ambulance services. So our COVID vaccines, community paramedicine. Does anybody do wheelchair? Yeah. Yes, I know we do wheelchair. That's once again, you don't count. Can you report revenue for billed ground ambulance transports by healthcare payer category? So can you break down your Medicare payments, your Medicaid payments, your commercial payments? Indicate if your organization received any revenue from paid ground ambulance transports from the following payers. If you can't separate them out, don't report it just under patient self-pay, report it underneath the primary payer category. And then how often did your organization try to bill the following types of payers for the amount owed for a transport during the reporting year? So should I have my payer categories set up in a certain way? Yes. And your billing agencies should already have this if you're not doing this in-house. But you want to set them up for traditional fee-for-service for Medicare, your Medicare Advantage plans, your Medicare HMOs, your traditional fee-for-service for Medicaid, your managed plans are CCOs here in Oregon. TRICARE, VA, commercial insurance, workers' comps, and then our self-pays. Yes, thank you.
I'm sorry.
Auto insurance will be under commercial. I'm going to sidebar for just a second of if you're not separating out your managed cares, your Medicare and your managed cares, I would definitely do it. As more managed cares happen, we're seeing that we're getting paid less because they have higher copays. So it's a way for you to be able to track that, instead of our ALS or BLS allowable, we're getting $80 because they have a $300 copay. So if you're not doing it, separate it out just so you guys can see the trends of what's going on with that. Your Medicare and then your managed cares, your Medicare HMOs.
So can you touch on that self-pay again and how you if you can't parse it out where it goes?
So if you can't, so for your secondary payments, you can't parse out, you know, this was a secondary payment from the patient, copay, deductible, then put it underneath your bucket of who the primary payer was.
Some billing companies have it set aside differently and some don't. So don't stress too much about it.
My reporting system is not very good at telling me I can look at just what my current payer is sitting at or my primary payer is sitting at. I can't look at both. So yeah, don't stress out if you can't, you know, but you can look at your straight bill patients, put those underneath the self-pay. So if you're able to divide it out of your primary and your secondaries, you receive revenue from category A, indicate the cost, and then indicate that the cost sharing for that, your copay, your deductible, the amount for the transport that is billed to a patient was included in that. So if you're able to split it up, this is what you're saying. If you're not able to split it up, then just put that total amount paid for that transport underneath the primary payer. Does that make sense? So example, Kaiser paid 600, patient paid 200. The report shows 800 total to commercial. Or if you're not able to, the report shows 600 to commercial and 200 to private pay. Like I said, I'm only going to be able to show the 800. I can't split it up. So indicate if your organization received any revenues from any of the following sources during the collection period. Examples is contracts, membership fees, sales of assets. Did you sell a vehicle? Did you get any grants for your vehicles? This is where that stuff's going to go. So your contracts from your facilities, hospitals, nursing homes, prisons, any other businesses. Yes, you did. No, you didn't. If you did, what's your dollar amount? What percentage was attributed to ground ambulance? So if you got a huge grant and part of it went for a truck, fire truck, and part of it went for an ambulance, you're going to split that up. Subcontracted ambulance services, are you guys leasing yourselves out to other places? Standby events, what's your fees for that? EMS services, not transports or contracts. This is going to be like our COVID vaccines. I think we did another couple other type of vaccine clinics, so we'll put that there.
Yes.
And
And we do contracts with like local events. That goes here. Because that truck stays there, it doesn't transport, it just goes here.
Membership fees. Does anybody have a membership program? Okay. Charitable donations, executive loan programs, chief executive officer, business development, any money we're receiving for that. Local taxes that are earmarked just for EMS. I wish. If it's just earmarked for EMS, yes. So contract revenue from local governments in return for services, any of the cities subsidizing per transport, for a year, whatever, that's going to go here. enterprise funds and utility rates. Rebates? Is that what we're talking about?
For some
Yes, for
areas.
some areas they do that.
Any money that's coming in.
Some of this is unusual.
So we just got 9 positions on a water bill, on a water fee. Is that gonna fall under this, or does that go?
So are you guys getting the money from?
The money and then we're hiring.
That's where I would put it.
Okay.
Because you're gonna put their wages in their wage section,
Yep.
and then you're gonna put the money.
revenue
coming
to
in
pay
up
for it here.
Because it's not your normal revenue for fee for service. But you still need to account for that levy, grant, whatever that money coming in is.
So we have, sorry, we have levy, like we have a levy and we have tax base, but it covers the whole health district. So a percentage of it obviously goes to EMS, so we take out that percentage.
Mm-hmm.
that would go to EMS.
Yep.
So if you look, it does ask for the total amount and then the percentage attributable to ground ambulance. So you can put the whole amount, that levy, how much the percentage. You had a question?
Was that the same?
That's gonna be my question.
Okay.
If it's a levy where the money is shared in the department.
Right.
Take out.
Yep.
So
Yeah.
What if you get a big donation from somebody that loves the fire department, but it goes into an account that isn't spent yet, so you don't actually know it's gonna be spent on firefighting equipment or something for EMS?
Is it earmarked specifically for specific?
No, it's just for your health district.
I think it's usually for the fire department.
Uh-huh.
I would say if you're not using it during that reporting year, I wouldn't necessarily put it in revenue. But if you're using it during that reporting
And we
year,
know,
I would put it,
obviously.
yeah.
Because then you're also gonna have costs associated, yeah.
Otherwise, it's gonna sit in a account and wait to be spent, so it really isn't yours. It's only yours once you get it and spend it. If you get it. and spend it.
Well, the only thing is if you do cash or accrual.
I'm guessing.
Oh,
Yeah.
yes.
So do you do cash accounting or accrual accounting?
Yeah,
Oh, it's a hybrid model.
Yay.
Excellent.
that would be a cash.
Then I would do it the way.
Yeah, don't count it unless you've used it.
Where should we put GEMTCCO revenue?
What is that?
QAF funds, GEMT.
Medicaid supplemental.
Are you, because you guys are getting a lump sum for that, or is it? It's still not being added to each individual transport's revenue. Yeah.
Right.
Let's call it for another.
No. I'm actually thinking it might just go underneath the other, or,
So again, what we're trying to do, make
Yeah.
sure we get revenue, what we get in, right? If you can't put it somewhere, other is okay. Are you gonna?
yeah.
I'm phoning a friend, however, again, not to, as we come up with more and more scenarios, wherever you put it, just put in the notes where you put it.
Mhm.
It's just making sure that you accounted for your revenue against your expenses.
Yeah.
And if, whoops-a-daisy, it's in the wrong category for what it needs to be.
We just don't want to do it
honest with you.
twice.
Right. The more important thing is don't double book it. And, you're not going to get audited because you put it under other and it belonged under,
Taxes and levies or something.
Yeah.
But I'm asking a friend.
Let's take a look at Amber in that section too. I'll pull up my computer, take a look at Amber when we get to Amber. It might actually have a section for that.
That
This
says-
is not the whole entire list.
No.
So it may actually have something for that. So let's take a look at that too.
So the last one on this is, any sale of assets or services. Any bond or debt financing that we received revenue from. State, local donation, surplus of vehicles, durable equipment, other donations. So including the fair market value for donations, not counting labor, facilities, vehicles, or equipments, because we've already accounted for that in the earlier sections. See, special purpose grants. I know. Yeah. Yeah. I mean, it could go special purpose grants. It could go other, I mean, we just want to count it. And then any matching grants that, you know, the state is matching for something. Any technical assistance subsidized for your training, demonstration grants, congressional earmarks, or other. We just want, you know, just like with the costs, we want to make sure we're capturing all of the costs that we're spending and then all of the money that's coming in. So, do I have to report any provider relief funding my organization received? We received the revenue from it. So that one, where did we talk about that one should go? The provider relief funding. The governmental.
It's a matching.
The matching one?
Yeah, it's on there, right?
Mm-hmm. Yep. Yes, question.
I have a question. Do you include tax monies if you are a special district?
So you're receiving those funds. Do you receive tax monies if you're a special district? You're receiving those funds and you're using those funds for your ground ambulance. Then yes, we need to include that as revenue coming in. Any other questions?
Should it go under the local tax?
Yes.
Ours is property taxes, so.
Yes, your local tax is earmarked for EMS services.
Again, when you get to this section, I mean, it's long, there's a long.
Yeah.
Put it where you think it fits best. Make a note, again, make a note, make a note, make a note. Make sure that you know why you put it there and so that the next person can put it in the same spot. We have to do this again.
You're implying they'll quit after this.
I'm implying they will not quit. That's why you make it up.
Right, exactly. Yeah,
We don't know, we don't know, we don't know. So you'd rather be prepared the next time, or the people behind you be prepared, to be able to do it again.
So now we're at our members. Any other questions on revenue? I mean, it is the easiest, most straightforward section.
Believe it or not.
Yeah.
One other quick thing I would do, when you start entering stuff into Amber, remember when we were talking about PICOs and who's the person and whatever, I'd make a little note on your first page who the email address is of the person that's currently, so that should down the road, you know, we end up having to do this again and, you know, you've got some documentation and aren't doing the, I better call and find out how to get access to this.
And don't wait until May 30th. I mean, so Michelle and I actually, we kind of took a week. We didn't get the full week because, you know, we had to work and get interrupted. But, you know, we found out that when we had to register for CMS's portal, 2 people have to register for it. The person who's entering and then the person who is going to certify. Yes.
Actually, it can be the same person, but what has to happen is the person who registered and got the role as enterer has to then notify them to take that role off and then submit a new request to be
the certifier. Okay.
Right?
I would highly recommend that you have both.
Someone else look at your
The only
data,
reason I
though.
say that is because you can get numbers inverted, people make mistakes. And so you're taking this print off from Amber and somebody's gonna enter the information and not care what the information is. And to me, that second person says, that doesn't make sense. It's the accountant type person who says, these numbers don't jive for me. There might be something wrong here, and can then go back and make changes.
I picked the enterer. You're welcome.
I think.
Yeah. And it did take a little bit of time because yes, they do have to approve your, you know, application for that.
You can
So-
have an admin type all the
Mhm.
information in for you and then you approve it.
Mhm.
You could have an EMT type all the information in for you and then you approve it. It's nice to have two sets of eyes on data. It's easy to get into it and make an error. And so this is kind of one of those checks and balances that kind of helps with that.
So this is separate from the PICOS conversation though.
Yeah. Any other questions?
Anything else on revenue? Okay, so we'll start some scenarios. Lunch should be here momentarily.
Yeah.
Maybe we can get through one.
Yeah.
And
All right. So we talk a lot about the why, we talk a lot about the what. We're going to talk a little bit about the how. So this is the Amber system itself. If you haven't been logged in, this is what it's going to look like. You're going to log into the system. You're going to have an email address and a password. I always click remember me just because I don't want to have to remember all of my 20 passwords that I have. There is a forgot your password option though, if you do forget it, or if the person who set this up is no longer with you and you have an account already, you can reset that password. Now, one thing that I did at our organization is I made an accounts payable email so that if people change within the organization, we can change the name under that, but that email never changes. Instead of having one person associated with it, you can have an email associated with it that goes to multiple people. So some systems are robust enough to be able to do that. This is that type of place where you would use something like that. Pecos is that type of place that you can use something for that. So again, we're not lawyers. We don't give legal advice. So you're going to say, yep, we understand that. And then you're going to launch that cost data collection. So we have those other surveys that we've done in the past, and you're going to launch that survey. Big key point. Look at the year when you go in. Make sure it's the correct year because some people have entered data and that year has changed and they panic because all of their data is gone. It's not gone, it's on a different year. So make sure you're picking the correct year and that year will populate at that top left side in the blue.
do you want to, before we get in, because I know there was question of being able to go in and update your Amber data throughout the year.
Oh, so.
Talk about the update that's happening.
Little infomercial here. So, right now, Amber is a finite platform similar to what you would be doing in the CMS database, where it is, you put a number in and it isn't transactional. You can't put your numbers in for January and then add your February numbers and whatever, and it'll add it up. But come July, we're going to have, the way that I look at it is, this is TurboTax for ambulance services. And in July, we're launching QuickBooks for ambulance services. So you'll be able to put in your monthly data and then it'll total it up for you. And it's very transactional. If you wanted to pull just what you had for February, you could do that. And we're launching that, and you will get that included as part of your free welcome to the AAA, enjoy it while you can services. So, and I think that will be really helpful because one of the other things you'll be able to see is, and I think this is years 3 and 4, you're going to benefit more, I guess, is if you're entering in data, you'll be looking at your January data and whatever, and you'll go like, wait a minute, why do I have so much more in January than I do February? Or why is February so high and January isn't? It'll really help you put in those numbers in a transactional way. So that's the way that I'm looking at it. This is TurboTax, and in July, we're launching QuickBooks. And if you've ever used QuickBooks before, it's like easy peasy.
The other plug I'm going to put in is there are Prodigy videos, and you have access to those through signing up for Amber, through being a AAA member, through this whole program. You have the access to those videos. Those videos walk step by step with each section. They're sectioned out. So you have that person who needs to enter the specific data, watch that specific video. It'll help walk them through that. Again, if you get lost, if you get stuck, if you're starting to pull your hair out, don't. click the contact us and make sure that you get somebody on the line right away.
So I'm entering data this year, but I'm putting in last year's data, should I backdate that to 2022?
However you need to do it and that you're going to remember, but that's how I would do it because I know I'm starting in that year, ending in this year. Yep. But just remember, once you change it, it might change back to 2023. You didn't lose your stuff. You're just on the wrong year.
So, but we're doing fiscal year reporting. And we're year one reporter. Right. So do I have to do 2022, July 1 to December 31?
It's just a year.
Yeah.
Okay.
It's just a year.
So that's the reporting year, basically.
Yes. Yes.
So if you've got multiple users, then do you all use one user sign-in?
Nope, you are able to add people to Amber to get in and access it and put their data in.
And how, you said it was quite secure, so we couldn't see each other's data. So how does it link like the second user to, so they're all linked to the same place?
Your users are going to see your own data. Yes.
Oh, well, that's no good, right? If you've got, say,
Exactly.
operations entering
Yeah.
stuff and billing and
So
stuff.
let's say you didn't want people to know what your payroll looked like. I wouldn't put them
Okay, sure.
as a, as a user, but also remember, again, the data is, because this is like TurboTax, your data is aggregated. So when you're putting in payroll, it's all your payroll.
Right.
So it's not like they're going to see individual records of, hey, Maria, you made bank last year. But you do want to think about who's going to have access, and also think about you can't target what fields they fill out. So be a little careful, because you could be filling out the data and say, hey, I need you to do your payroll, I need you to do this. And for whatever reason, you're looking at something and they change it. Interesting.
Be careful who you add. Make sure that the numbers that they're putting in are somewhat vetted as well.
And it's only their number, and it's only
Yeah.
what they were supposed to be doing.
Yeah.
But eventually the NPI's in there, so it'll all list, right?
They'll be able to have access and see all the data that's in Amber from yours.
Just yours.
Amber is like a notebook. All you're doing, it's just electronic. All you're doing is passing that same notebook.
Yes.
This is your specific.
I think she's talking about, if I understand, other organizations or the AAA being able to see it. Okay.
No, so Jennifer's got an account and I've got an account, so she's gonna
Yes.
enter HR stuff and I'm gonna enter operational stuff.
Mhm.
But however, the purpose of Amber is that all that data is, merged and cross-checked and everything, but I only see what I've entered. She only sees what she's entered.
No, you can see
You
both.
see everything.
Okay, good.
That's what I'm saying. It's like a notebook. It's like you filled out the first 3 pages, and then you're going to hand it off to Jennifer, and she fills out 2 other pages and whatever. Everybody's going to see everything, but that notebook is your notebook.
Okay.
No one else from any other company sees it, or vice versa. And this is, just so you know, we don't see this. I can't get, this is your proprietary information. So we have an external source. This runs on an external server. We have an external contract. We even have the security system set up. So the only thing we'll be able to pull is the same thing that CMS can pull, which is aggregated data. I'll never be able to go in and say, so-and-so really messed up their Amber data, like they said they had no costs under, medications. Like, are they getting everything for free?
Yeah.
No, never will see it.
So here's where you add that user. Again, we kind of talked through, be careful who you have added as users. Make sure that they're at the level that they need to be to add them, if that makes sense. So you don't want to add your EMT here necessarily, because they're going to be able to see all of that data unless you trust them and that they have the position and authority to be able to go in and see that data. So you said you have the 2 of you, you're going to add those people. I'll add my HR person so they can go in and put that in there, our HR manager, so they can go in and put the hours and the wages, because it doesn't make sense to me to have my accountant go to my HR person and ask for that information. Oh, and internal and external. So if you're the billing company, you can add an external user here. The nice thing about Amber are these little question marks. They go into more detail about what each section means. So you can click on that and it'll give you some more information about that if you're not understanding what they're asking for. You're going to put whether you're accrual or cash basis. You're likely cash. We're kind of a merge of it, but we're really a cash base. And then the total revenues for the year, how many ambulance transports. So you're just going to go all the way down this. You're going to put the cost, you're going to put the contact information. Again, make sure this person you have listed somewhere else in some other place so you know who that contact person is. The email, the name of the responsible person, and then the name of the person completing the form. All right, so NPIs. You're going to go and list each NPI, and it's going to tell you the completion of each one of those. So if you have one NPI, it's going to go through and it's going to tell you the percentage that you have complete on Amber as you're working through it. So you can start here and go there and go there, but until it's 100%, you're not done with the report. So it tells you that right off the bat. So if you're the person overseeing this whole thing, you can see how people have progressed through it. Your contacts, your profile. So again, here's where it starts in those questions that we talked about earlier. It's one box, one bucket. So if you read through these questions, it's not, you have a question?
No, I'm just thinking in July, this will look different because then it'll be a monthly thing.
Yep.
How much visually is it going to change?
You know what? That's a really good question. I haven't beta tested it yet, so I couldn't tell you. I would assume it's going to look exactly like it, but just month to month and transactional.
I'm wondering if under the year, it'll have quarter one or month one or something like that. It would be
It would just be like, January, February, March, but the same. The other thing it will do is we're working, things are so expensive, but like, for example, AAA can't afford to use ADP or any kind of like big fancy payroll system. So we are working with a very small company that if you wanted to, you can link it and it'll do like any volunteer stipends for you or anything like that. It will, for a nominal fee, help you with that. And we're launching that as well with it. So it may look a little bit different for things like that, but we're really trying to make it so that all it does is at the end of the year. So for people who are like reporting for next year, the timing will be perfect. You could start with your July numbers and
July, August,
and then
September.
do them every month. And then by the end, you won't even have, the only thing you'll have to do is certify it.
Do we have to do it month by month? Or we don't? It'll still be the option.
You just have to remember at the end of the year, most people have an audit. Most of your accountants and people who are dug deep in that audit, you're going to add this on their plate. It's going to be a lot. So if they know it in advance, even better. And they say, I want to just do it for the year, fine. Because I have to do a lot of it for the audit anyways. But it might be nice for them to do month over month. So it's a lot less work when it comes down to being underneath an audit and doing all of this. All right, so how many responses with or without a ground ambulance? How many ground ambulance transports? The number. How many were paid in full or in part? This is through the reporting period. How many ground ambulance non-transport responses? Of those non-transport responses, what percentage were attributable to ground ambulance? So again, that was that first bucket that we talked about, transports. That's through the reporting period. What percentage were in your secondary area? Paramedic intercepts are only New York. The others are going to be the ALS joint responses. I know we call it that everywhere, but again, we'll go back to that. Did you respond to calls with another transporting agency? Yes. So again, if you select no here, that's that skip logic we were talking about. It won't give you questions about reporting or responding with another agency. What percentage of ground ambulance responses are non-transporting agency? Best guess. And then what kind of labor does a non-transporting agency provide during these responses? So it gives you that checkbox. And then you specify if it's other. Food's not quite here. I don't know. Is the food supposed to be in here? Let's double check on that before we continue on, because I thought
The
she
only
said it was
other
supposed to
thing
be
I wanted
quarter
to, and I know we already covered this, but just to make it very clear, we asked CMS if we could do an API, learning new things every day, and which would like automatically allow you to upload everything in Amber to the CMS website. Of course, being the government, they're like, we don't let anything link to our website. You're crazy. And even though they actually liked some of the features that we had in our system, for example, if you just go to the CMS website and you didn't use Amber, you have to put in every single one of your zip codes. It doesn't have the neat map feature, or you can just draw a circle around your territory. And they were like, when we shared this with them, they were like, oh, that's really cool. Can you do that? No. So the other thing the CMS system doesn't do is, with the exception of leaving a field blank, it won't flag anything. It will not tell you if you made an error. So where Amber is intuitive and it'll say, well, you said you made $10 million, but you're saying you only had $20,000 in costs. That's a very high, net. It will flag fields if it seems to be sort of outside of the parameters of what would belong in there. And I think that's helpful too, because when you get to the point, CMS predicted, I'm just saying that nicely, that from start to finish, if you sat in one sitting and tried to enter in your data, 3 hours is what they're saying. I think they're cuckoo for Cocoa Puffs that's a technical term I'm using. I've been in the system, I've been with others as they beta tested it, and it took hours. So one of the things you'll be able to do, and we'll show you at the end, is you'll download Amber. It'll include your, everything. And then you can sit there and just have somebody key in and enter in all your data. And that could be your verifier.
Yep.
So just keep that in mind. I don't want you to think like you only have to, this is really your workbook, and then you'll go in and do the actual submission.
And the nice thing about Amber, it also takes you exactly to that spot that you made the error. It'll take you right back. You click on it, it'll take you right back there, and it'll tell you why it believes it to be an error. Want to cover some of this? Okay.
Okay, I'll let you.
All right. So again, we talked about these drop downs. So how do you define a response time? From when the call comes in to when a vehicle arrives on scene, or from when a vehicle leaves the station to when a vehicle arrives on scene, or other. And if you pick other, you'll have to tell them what it is. But they'll give you that option because, again, none of us do it the same. And so they're giving us these different options. Answering yes here to the do you measure this time? It'll give you questions about times later in the tool. If you answer no here, it will not allow you to answer any questions. It'll just remove those from your view. Are you required or incentivized to meet response time targets, whether internally or externally? And then it gives you, again, a drop down for those. Makes it a little bit easier than typing a bunch of stuff in and typing my verbiage versus somebody else's verbiage. So again, skip logic. Do you use volunteer labor for anything? If you answer no, you won't get any volunteer labor questions. If you answer yes, you will get volunteer labor questions. If you don't have volunteer labor and you get to here and it's asking you questions about volunteer labor, this is where you need to go back to. Do you routinely provide ground ambulance to 911 calls? No, yes, yes, but not around the clock. I actually know some services that need to answer yes, but not around the clock, but they're not going to.
But they're not.
Yeah, because we cover for them all the time. Oh, so your average trip time, again, this is that average of your trip times. It just gives you buckets to put it in. It's not specifics. And then your secondary service area.
And so this is, you know, the dispatch areas, you know, our city dispatch, our county dispatch, however it may be, we're gonna need to have conversations with them of, we need to know some of this breakdown.
I got that.
Can I interrupt everyone and tell you I'm
Okay,
so sorry?
I'm sorry.
DoorDash, someone from DoorDash stole our lunch. And now they have to remake all of our lunch. And so they've told me 30 to 40 more minutes. So I'm so sorry. I'm sure you're all starving. But we get to listen to a little more cost collection and hopefully let's hear some. Sorry. Yep.
It must have smelled really good.
That DoorDash is like feeding the family for a month.
Well, someone just walked in, I think, and said, I'm here for DoorDash, and they got given our very large orders.
Oh.
So they're remaking it now, sorry.
Oh, so then some customer is going to open their door to DoorDash and go, what? I can't eat this.
I think the drivers stole it, because they said 2 drivers stole it within a minute of each other.
That's a really good idea, though. Isn't that clever?
That is clever.
You just go to restaurants around like this, your town and go like, I'm door dashing, because they don't check. I mean, they all got their little.
Yep, they fill up their bag and out they go.
All right.
Oh,
And sure, I didn't want to steal a little door pennant from
What's
the
wrong with
hotel.
your
And Maria's like,
From New York,
wanted
but we
to
don't
know.
do this. All right.
all right, next section is service mix. So again, we're gonna go with those HCMix codes. Ask your billing company for that. If you use a billing company, your billing software should be able to pull all of these different in a report so that you know how many transports in each category you have. Anybody in here don't believe they can do that?
Not sure.
Okay.
It's on my list, to-do list.
Yep. So whatever they're billing, they should be able to do that. That doesn't mean they are able to do that.
Are you guys billing yourself?
We have with them.
Okay.
But you know,
So
we're
there
not,
should
we don't
be-
start till July, so we could contact them and say, by the way.
And I would
This is what we'll
think that they would be able to tell you, I've billed, free BLS emergent trips. I mean, it's different charges that they have to do. Yeah.
Okay, good. Good to know.
We could just snip that, send it an email.
Yes.
And say, I need this.
It's actually right in the tool. I'll even give you the tool and you can take a picture of it and then you can send it right on out. Yep. And then what percentage of all of the transports are in a facility? Anybody in here do inter-facility? We do too. So it's going to ask you what percent are inter-facility.
So we actually didn't talk about this before, of interfacility for CMS. They're not just counting hospital to hospitals. They are counting if we're picking up at SNFs. They're counting those as interfacilities. They're going back to SNFs. Skilled nursing facility.
What if you pick somebody up and take them to their doctor's appointment? Take them back. If they're-
That is not an ambulance.
Well,
Doctor's
is that
appointment.
it's not a, so our state Medicaid pays for those. So we do them in ambulances.
Okay. So where would you categorize that?
That is a interfacility.
That would be an
Interfacility, yeah.
inter-facility. Inter-facility.
Is it
I would do it as an
SNFs or
inter-facility.
emergency calls or
Because
just
it's
for
not, they
911?
are considering emergency calls at SNFs,
Even if
yes.
you're not a Part A stay.
Correct.
So you're looking at those
The
modifiers.
modifier. Which
That's
is
how you'll
something
pull
else, you know, the billing agency is hopefully able to pull for you.
And again, remember, the most important thing is not to double count.
Yep.
That's all, you know?
So are you guys gonna have an issue with that piece of it?
Well, we just have a hard time with our medics knowing which ones are the SNFs.
So, so it should
It's
be.
how it's billed.
It should
It's
be
your
by
modifiers.
the, yeah.
It's a
But the medics
monitor.
have to tell me they went to a
Yes.
SNF and they don't.
Well, but you should be able to know by the pickup address.
They should.
And your medic's not telling you to pick up address? God, I love
Some do,
medics.
some do.
I love medics.
Yeah, so it should be by the modifiers. That would be the way that I would go about it, and that's gonna be the best.
Are you
Closest.
dispatching? Is city dispatching for you?
County.
County. So that's where you're gonna get your pickup locations then.
They have a pickup locations, but are some of them closed?
And-
not still?
Oh, that's part of the problem. Yeah, you have,
Right.
do you have an apartment complex attached to a skilled nursing facility, attached to?
And with the memory care.
Right, right.
Yes.
adults, the memory care.
Yes.
skilled or
Do
not
the best you
skilled.
can.
Yep.
I mean, do the best you can. You know, if you can't capture, we want to capture the number of transports. If it's not necessarily all in that right bucket,
It's okay.
do the best you can.
Yep.
If you have your total number of transports for your year, and it doesn't add up to the bottom of this,
Right.
of your total number of transports, then that's where the issue is. Or if you have your total number of transports a year and that number is egregiously higher, you've double counted, and that's going to make our cost of providing service lower per transport, and no bueno.
Yes. And then it does ask if you do standby events. So those fairs, those concerts, those other things, yes or no. Again, if you say no, nothing, no other questions will pop up with that. If you say yes, there will be questions about that. So revenues.
So our total revenues received for everything. So that's including community paramedicine, that's including our COVID vaccinations, everything, all of our revenues, our grants, our taxes, all of that stuff that we went through, our individual numbers is gonna go here. Then now, what's our transport revenue? So what from our ambulances, our non-transport revenue, and then here's where we want, what was Medicare or Medicaid revenue? So that's where the payer types, that's where this is, you're gonna pull that from.
Then why do they care if it was a Medicare Advantage versus the other kind? They're just gonna aggregate it anyway.
So that's our totals. Here's where we're gonna break it down.
But she's saying, why do they care?
Yeah, why do they care?
I'll say this, I think.
I don't know why they care, I
think
know
we
why I
care.
care, exactly. I care
Yeah.
because of all of the problems we are having with our managed cares and how high those co-pays are and how much money we are no longer collecting because so many people are on managed cares now. I care, you know, the AAA will have this data. We can use this to try and help some regulation going on because it's not only us, but it affects our patients too. You know, where they would have had a $90 copay if they had straight Medicare, they've now got a $300 copay for an ambulance transport. It's a lot of money. So, yeah. But yes, the billing frequency. So this is saying, do you always bill for your transports? I always bill. I don't know who's gonna do a transport and not bill. So always, usually, but I always bill.
And one of the things to think about, and Scott, one of our faculty members, always says this, you know, these are really dumb questions because everybody's definition of always, usually, sometimes, never, those are kind of broad. You know, like sometimes I do. Well, is sometimes 3 times a year, or sometimes to you 3 times a month, or sometimes 3 times a week. So it's silly that they're asking this, but they're asking it.
And then just like what we went through before, here's where, you know, any revenues from contract facilities. If we didn't have any, we're gonna leave it blank. But, you know, if we had anything in these buckets, we're gonna put our number in here. Percentage allotted to the ground ambulance. And then our total's gonna come up at the bottom. So now, once again, revenue is the easy part, I think, for me. Revenue is the easy part, I think. So now our costs. So once again, our total costs of everything, then we want to know these 5 buckets for our total costs for those buckets. And then here's where the numbers really get going. Here's the breakdowns. How many of our staff were the EMT basics? How many were intermediates? How many EMRs did we have? So on and so forth. And remember, this is our W-2 employees, not our contracted people. If we didn't mark yes on our volunteers, all of that's 0. Our total compensation for each of those, hours related to just ground ambulance, and then total other paid hours. So here's our fire paramedics jumping on and off trucks. There's that number.
Are you counting EMT advanced as intermediate?
Yes.
That's, yes.
Our facilities, everything we just talked about, here's where we're entering all that. So our facility names, whatever we have our names, are they owned, rented, mortgaged, leased, donated, all of that. The square foot of each facility. You know, here's our annual lease, rent, or mortgage amount. Was it purchased in this year? The cost if it was this year, depreciation. And then our total costs for facility insurances, our maintenance improvements, our utilities, and our taxes, our multiple NPIs, and none of us have any of those here.
Under the cost of purchase this year, like, we're in the process of completely gutting and remodeling a fire station. Is that considered a cost of purchase this year?
That would be
I would-
exactly what it would cost.
Yeah, because you're not purchasing it, you're remodeling it. So you're doing maintenance. Yeah. I mean,
We
it's-
left the wall standing.
Right. That's how we get around, you know, some permitting stuff. We know that.
So maintenance and improvements
Mhm.
is where I would put that.
Okay.
And then our vehicles. And so, yes, Maria did confirm we are able to upload our vehicles into Amber also.
So the worksheet that you guys were asking about earlier, you can do both for facilities and for vehicles.
So,
So does fire truck encompass all types, like type 3, you know, all different types of fire trucks?
However you categorize it, I would put it on here and then I would make a note. So if you're categorizing it as a fire truck versus an ambulance, that's how I would.
or
categorize
other
it.
type of vehicle.
It's like in the, when it's bad weather and snow, we take out like our brush rig chain to go up the hill, the ambulance, versus like an engine because it can't make it.
Mhm.
So, just want to make sure that would be the right way to do it.
Yeah, however you want, you know, to put it in.
As long as it's consistent.
And then our mileage, any registration, vehicle licensing, insurance, maintenance on the vehicles is all gonna go underneath the vehicle section. We just said that. Did we totally bypass equipment and supplies?
We must have the other section.
Huh.
We can pull it.
Yeah. Yeah, we should pull up Amber. So this is saying, once we get the equipment and supplies in, and any of the other, we're gonna review it. This is saying, pick which one you wanna do, pick an Excel, keep that for your records, but then also go back in and do the PDF, because that's gonna give you the numbers of the boxes for us to input it into CMS's tool. And then here's where you would upload those worksheets. Sorry, this seems a weird jumping back over to here, so.
Not in order.
Okay, sorry, that's okay. So allocating your costs across all types.
For ground ambulance and then percent maintenance, fuel, all of those things. This is kind of how it's gonna go. So you enter that maintenance cost, ground ambulance is 95% of that cost, other is 5% of that cost. So then the second section is the fuel, 997,000 for the cost for the fuel. 94% of that is ground ambulance, 6% of that is other, so it's gonna do the math for you as it goes. You always have to have 100 at the bottom. There we go.
Okay, here we go. So our capital medical equipment, monitors, the annual, if we purchased it this year, the cost, the depreciation costs, did we rent or interest for it, maintenance and servicing on it, and then our non-medical, once again, the totals, uniforms, any other non-medical supplies. Here's where did you have medications? Yes or no? And these are this pull down, multiple NPIs, and we don't have those for everybody here. So now our other, here's our contracted. So it's our 1099s to our medical directors. Did we contract out the EMTs, our billing services, our dispatching services, our accounting, facilities, our maintenance, you know, people coming in cleaning, all of that stuff. Did we contract out IT, or do we have IT internal? Software licenses, board of director, trustees expenses, legal, any advertising, any meeting, and then physicals or medical expenses. Now, that's not the health insurance though. Yeah.
Can you go to the last slide?
Mhm.
So on the capital medical equipment, we got a grant for self-loading cots, but we also had an out-of-pocket amount.
Mhm.
So under the purchase cost, is it the full purchase or just the amount we had come up with?
Mhm.
Okay.
Well, because then your grant money is gonna go back into your revenue.
Revenue.
Yeah.
Okay.
It comes out in the wash once they do that calculation.
Thank you.
Can you go back to the slide?
Yes, this one?
Yeah, so if you think about auditing, a lot of you are with a city. Part of that auditing process is you guys too. If you're shared service and you're getting audited, part of that auditing cost or those legal costs are you guys too. So again, making sure you make a big, long list of all of these things, which are in here as well, and they're on Amber. Make sure that you're capturing those costs because there is a cost associated with that. Whether you're directly paying it or not, the city's paying for it. You have to have that audit, or you have to have those legal fees, or you have to have those professional fees, so make sure you're capturing all of that.
And then, so here's the summary. And so basically, if you had multiple NPIs, this is what it would look like. And then down at the bottom, here, look for any issues. So if something didn't add up to 100% on one of the columns, it's going to take you there. Ta-da!
So that's what it's going to look like if you made it
Back to, yeah.
So, you guys worked out what the definition of super rule is?
Pardon me?
You know what the definition for super rule is?
That's a great question, because as you all know, you don't put that when you're submitting. CMS is the one that converts it to whether it's urban, rural, or super rural.
Based on the zip code, the pickup zip code.
So I don't know the answer to that.
They'll do that calculation on the back end with all of those zip
Service
codes
areas.
that you're putting in. They'll probably
You won't
try
do it,
to,
they will do it.
yeah, they'll probably try to determine a percentage based on your zip codes. Probably.
I was just curious, because when I signed the Amber sign up, it asked me what part of us was rural and what was super rural. So,
Yeah, off of that, so we're all, we're only 2 zip codes in our zip code. The second zip code we run into is just our suburban. We use super rural, or what we went off for the definition when we put it in the system was like our frontier and rural areas. That's what we did for our, because we only have 2 zips and it's really hard to figure out what that would be if you're only going off those 2. There's no other zips way out there.
oh, it's true.
Where are you at?
Ashley.
I have to think you're super rural because I know Roseburg's super rural. So, yeah.
Since we're talking zip codes, are we inputting all zip codes in our ambulance service area?
Primary and then
Second.
secondary. Yep.
What do you mean by secondary? Like, what if we were qualified the next county over for health? It's not our service area, but they do ask us to do it.
Do you routinely go into that service area to do mutual aid? If you do, I would put it down. If it's once in a great while, so once every month or once every couple months, I wouldn't necessarily put that as a secondary service area. Do you have a mutual agreement with them? That to me tells me that's likely your secondary service area. If you have those mutual aid agreements, that means you're agreeing to go into their area if they're not available. That's what I was joking with earlier when I said some of them will say always, but they're not always available.
So I guess I'm kind of confused. So we have a city, and our city ambulance fire department provides ambulance service to, Kyle, look at this, a significant portion of the entire county.
Thank you.
Yeah, you're welcome. I forgot those 26 houses.
Wow, there's shots fired. Fires in Albany.
Anyway, it's a running joke now because I screwed up on a Teams call one day. Anyway,
I think people are cranky.
but there's like 7 zip codes within our designated ambulance service area. Those are all considered our primary?
Yep.
Okay. All right, cool. That's what
And to that end, my primary and my co-ambulance's primary might be the same zip code.
Right.
Because you may both respond to that area. It may be cut in a weird way. So you may both have that, that's okay. The same with secondary, that's okay.
Yeah, I mean, I'm at Medics, you know, so I'm in South Pacific County, Astoria, Seaside, Warrenton, Gearhart, all the way down to Cannon Beach. Those are all my primary zip codes.
So he services 23 of the houses, is what I've heard.
It's more than that. Add a couple zeros.
If he services the same zip code and he has a piece of that that is his primary service area, you'll both put it on your report.
I made a mistake on a call. I said that we covered all of Benton County.
And someone said, oh, no.
I'm not sure about that name.
I just texted you.
Hey, that was fine.
You notice how far apart we're sitting?
But we do like each other.
Yeah, we do. Actually, went to paramedics.
That's the always, sometimes never, like,
Right.
that one time.
Yes. Sorry. It's the floor.
Yeah, I know, I found that out.
It's the floor. Okay, so what we were talking about before, make sure that you are setting up for CMS's portal. And here's the website for the portal. The registration, they've got a workaround apparently to where one person can do it, but you really should have 2 people looking at it.
I thought I read that we couldn't, we're in the 4th year, we couldn't even.
You can't, no,
request
you
it
cannot do it
till-
until that reporting period begins, yes.
So will Amber let us see all the questions ahead of time? Because like,
You
how
can
do I
go into
prepare
Amber now.
if I can't even see the
Yes,
questions?
no, you can go into Amber right now.
Okay, and Amber will show me.
Yeah, if you wanted to do a play around and see how it flows, you can, yeah, absolutely.
It's so much easier to set it up with all these people to start collecting,
Right.
you know, so they have a system in place to
And
set
once
collected data.
July comes, you know, yes, they could start, okay, here's
Rather
my
than
monthly this,
scrambling.
right?
Yeah, okay, perfect.
So this is all setting up the CMS portal.
So you should already have access to Amber.
Or you have some people here who've been getting emails.
Have you waited a couple weeks?
Yeah.
It says that, but you can log right in.
Yeah.
Oh, really?
Yeah. Because typically if someone just requests it outside of a collection workshop, the faculty has been traveling all around the country doing the workshop, so they may take them a couple days, but yeah, they've been trying to get everybody registered who has requested that right here today.
Yeah, like you should have gotten an email from Tristan Good, and, because he's forwarding them all to me as he's doing them, so.
So your inbox is.
Hello, Chief of Jefferson, and get them all. So,
Oh, once again.
that's what she said. Your email. Because it tells me that here, they'll be in touch with you.
So try going to that Amber site, emsamber.com, and put in your email and your password, or create an account.
No, it's not working.
Amber.
It's Amber 2023.
Okay.
Oh,
And it kicked me out of the registration. Every time it like kicks you out.
So here's ours I'm logged into, right here. You can take a peek. When I launch the survey, I can go in and any of this and look at all of it, look at all of the questions, look at my profile. I can go through and look at all of it.
So if you haven't gotten either before this session or after an email that looks something like this, it gives you, it'll tell you your username is your email address and it's Amber 2023 is your password. It lets you into the AAA website. It lets you into Amber. It also will, you can click on any of these things like webinars, on demand, or access to the experts on that list, thank goodness. Quick, that's like an e-manual that like says like this is the definition of this, and this is the definition of this. If you want that, great to print out. It's like a, and then if you have other people that are filling out certain things, I would hand that to them and I would say like, and you can print out Amber, and then if you wanted to, like you were saying, like give out like, this is highlighted,
This is your
whatever,
section.
this is your section, make it happen, you know.
Otherwise, if you go to the AAA itself, they have the cost.
Yeah, you can just go to www.ambulance.org.
Yep. And at the very top of that website, cost collection is up at the top here. And if you click that, it'll give you the access to log into Amber. And I think it also does the Prodigy videos on there too.
So we can log into the data collection system. We don't have to do everything at once. We can log in and log out.
I would do Amber and set up once it's open. Are you in the first and second year?
I think I'm in the first year, but I'm not sure if we're doing calendar or.
That doesn't matter.
I'm wondering if I logged in, if I'd be able to see.
Once you go to ambulance.org and you click on cost collection, it brings you up to ambulancereports.org. It's the same website, we just used a different name to be clever. And you can actually check the CMS ambulance service resource page here, and it will bring you up to CMS, and CMS does have listed who's supposed to report in years 1 and 2 and 3 and 4, so you can check it that way. And then you can go into, you click on Amber, and then there you are. You go to the login button, and that's where you're going to put in your email address and Amber 2023 if you're registered, and then you'll see the first screen. I'll say welcome.
I'm just trying to figure out if we are supposed to be doing January to December or July to June. That's what I'm not sure.
Yeah, who, and you don't have any idea who filled out the, or,
It might have been me.
Yeah.
listen, I totally appreciate
ago.
that answer.
I vaguely remember, you know, it needs to be filled out in 30 days. And
Right.
Do I know what to put now?
That was pre-COVID too, I bet.
Yeah, exactly.
My new favorite expression is with my staff is I actually use on my emails, like, I might have dreamt this, but did I ever say, like, did we ever? And, you know, sometimes it's a dream.
Are you guys a fiscal?
Yes.
I would assume you did.
That's what I would say, because we are fiscal, but.
I know.
Look at it this way. If you don't remember, and you're fiscal, then it defaults to this way. Just like the way that I would think about it is, you know.
Where did you say it?
That's what, I mean, I'm sorry, it defaults to calendar. It always defaults to January through December if they didn't hear from you.
Once you're on that main page, where did you say to go to look up to see if you're year 1, 2, 3, or 4? I can't remember either.
We can pull it, why don't we just pull up the spreadsheet area?
Yeah, why don't we pull that up there?
And then if people,
While they're setting up lunch.
Oh, well, thank you.
They're working on it.
Oh.
And yeah, we may not have you entered quite yet. Oh, which you just.
I was gonna say, yes, yes. So I just got this for you.
So this up here is what CMS's tool looks like. So basically, you know, it's all of the same questions. This is just what their format looks like. You know, it does also have the smart logic of it's going to skip things. Yes.
Can you guys check to see if something for my district is already registered?
With Amber? Yes. Yeah, we can look at that.
we'll have to go through.
We're on here. If you just,
So now you're showing us the portal,
this
right?
is what CMS's portal looks like, yes. So just the difference of format. And so, like we said, if you do print out, you put it in Amber, you print out the PDF, you can just go right on down and just fill these out.
So if you don't know if you're year 1, 2, 3, or 4, let me know. I'll pull up the spreadsheet up here. We'll do a search on your NP, so you need your NPI. Well, we can do that right here.
So your revenues, do you always bill, never, sometimes?
But I did this morning, I couldn't remember the whole number.
And here are the things that the two do, or don't do. Yes. Oh, yeah. Right, exactly, what we were talking about earlier, yeah. Yeah. No, because I was fine.
Yeah, and then,
Yeah. So they're setting up, if you guys wanna, get up, stretch away, run to the restroom, and then by then they should be ready for lunch. We are pretty much done with the presentation part. I mean, if we can look at the actual tool, you looked up your guys' MPIs.
Looks like a lot of people are kind of finishing up. We'll give you some time back today. We did get through this a little faster than normal because we didn't have some of the longer pieces in the beginning. You guys all know why we're doing it. We wanted to really go over what it is and how to do it. So we got through it a little bit faster than normal. One of the things that I wanted to point out that I think was said earlier, and I'm not sure everybody caught it, is if you're picked in year 2 and 3, you can't access the CMS side of this yet. You can access Amber now. And you can start getting that data into Amber even for this year if you want. So the more data we have by the time we get done to the very end of this, you can do this every single year. It'll give you those same reports. So you can look year over year at how you're doing and compared to revenue and costs and all of those things. So you cannot get into the CMS side if you're year 2, 3, and 4, but you can get into Amber. So just giving you that information. You cannot start, stop, and skip around if you're in the CMS tool. You can in Amber. So you can see, if you guys want to take a look at Amber, I have it pulled up. I'll show you kind of how it looks like in real time if you haven't had a chance to take a look at that. But in the CMS side, you're going to have to complete a whole section before it saves your data. This was something that we upgraded after the first round or first revision of it. They didn't let you save anything. And if you didn't do it in its entirety, nothing was saved. And we were all like, that's not going to work.
I know.
So the American Ambulance Association went back to them and said, nope, you got to at least have some way of saving that data. So as we talked about earlier, the CMS tool requires a submitter and a certifier. Sounds like there's some ways around it, but I would still have 2 people looking at that data. Exporting your data, so you'll be able to, out of Amber, export your data into both of those ways, that Excel spreadsheet and that PDF form. That PDF form gives you all the information you're going to need to fill out that CMS tool. The exporting of the data into an Excel is for your files. It also is really nice for those number cruncher people, because then they'll look at that data and do all their pivot tables and fun things with it. They'll really enjoy it.
And this is an old slide though.
It is.
Because we can do the upload templates.
Oh, I
The very
haven't gotten to
bottom
that.
one.
We evaluated and completed the ability to use templates.
Yep. So you can use templates on both tools. Yeah. So immediate action. I have all of the zip files pulled up on my computer. If you don't know what year you're in, let me know. You need your NPI and we'll search for you and figure that out before you leave today. I'll stay and whoever needs to look that up, let me know. Make sure that you have that data team so everybody knows what's expected of them. So again, you have people who have very full plates. Let them know what's expected of them. Let them know ahead of time what data you're going to be looking for so that they have the time to allocate to that in the midst of all of their other stuff. Contact your MAC.
What's a map?
Medicare carrier.
Okay.
So
Noridian for us.
Yeah. Sign up for Amber, which most of you have. If you don't, let's make sure that you're signed up by the end of this session today. Review all of that data in Paycos. Make sure it's all up to date. Take a snapshot of your personnel from the beginning of your reporting year, where they were. Because remember, where they were is where they stay with category, and then they were paid or volunteer and all of that. Track your volunteer time and hours as best you can. If you don't have a tracking system and you're in the next reporting year, make sure you get some sort of system put down, whether it's just a spreadsheet or recording on a tablet or whatever you need to track those hours. Update or modify your dispatch system to capture the data as needed. The same with your billing systems to capture the data as needed. For those of us who have to report by the end of May, that ship has kind of sailed. Do it going forward, because if we have to do this again, you want those systems set up so that it's a lot easier for you going forward. Take a snapshot of vehicle mileage because you'll need that mileage. Check payer categories and make sure that your billing company knows that information and knows what you're going to expect to be able to pull out of there. So there's the free Prodigy account. How do you log into that? Do you remember?
I think it's
That's
on the cost collection. It's just
The cost collection page of the AAA site, I think.
click on the link.
Okay.
And just one thing so when you got your grant, you also got a year membership to the American Ambulance Association. Even if you don't use Amber, even if you have somebody you've outsourced your cost data, and you don't have to even think about it except to provide them, please use your AAA benefits.
Yes.
We have, all of our publications are free. All of our webinars are free. All of our, we have like unique relationships with certain vendors for savings. And I don't want you to miss out on getting a free year of stuff if you want. And I just would encourage you, like today, I think we have the Medicare update was today.
It's us.
But it's on demand, and so you're a member and you get it for free.
And so, yeah, there's lots of webinars, covering all sorts of things, operational to billing to HR. And so everything's on demand. As members, you can go view those for free. Medicare manual, Brian Werfel writes a manual that is in real people English. So that's all on there. Scott Moore does an excellent HR manual. So yes.
I have my Medicare manual sitting on my desk because somebody will come and ask a question. I'm like, I think I know the answer, but you flip through it and you find the answer very easily. So definitely utilize that membership. Even if you were a AAA member or still are a AAA member, please utilize those benefits. There are so many benefits, and it connects you to other EMS providers too.
We also have a counselor match program. One of the things we're really paying attention to is the resiliency and the health and well-being of our workforce. And so it's a private, they fill out a little form on their own, and it goes to your location and it matches them with the counselor, and we pay for 4 sessions so that we can get them in and seeing somebody and hopefully getting the help that they need. And I think that's really important. So please, you might as well, even if you don't renew, what the heck. So I didn't say that out loud, Sean.
No, it's the first time I've ever heard Maria say that, because normally it's like, please renew your membership.
Yeah, I'm a little bit of a money
She likes
person.
it.
So, but not this time.
Again, hello@ambulance.org. We appreciate you guys taking the time today. I know this is not fun material. It's very dry material. It's not fun to sit and listen to for a good portion of a day, but we appreciate that you guys took the time. Please, please, please reach out to the services around you. Make sure they know about it. Make sure that they can go on and apply for the same Amber.
grants, yes.
They can apply for all of the same stuff. So please make sure that you're reaching out to all of those services around you or next to your neighbors and making sure that they're, especially if they're small services, making sure that they're putting that data in there and make sure that they have all the same tools that you do. So, and then those certifications for the NAP will be sent out by email.